Yes, it should be recording now.
Okay, I'll change my name. Okay, one, two. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. People's names keep moving around. All right, we have 13, which is more than half of the total seats on the council, so that qualifies as quorum, and we are able to begin.
All right. Good afternoon, everyone. My name is Annette Magicotami, co-chair of the System of Care Advisory Council. Welcome, everyone, to our November meeting. I am also representing Family Voice and those impacted by juvenile justice. So just to go over our agenda, first we'll review our objectives of the meeting. Then we'll do a roll call of members of the SOCAC and review our group agreements and then move on to the agenda. Today's objectives are we're going to hear updates from the System of Care Advisory Council subcommittees, family and youth. We're going to discuss the proposed SOCAC legislative concept and vote on whether to adopt them as SOCAC bills for the 2025 legislative session, and then we will hear public comment. So I will go ahead and turn it over to Anna to do the roll call.
Okay. Allison Stark and Sonia Little Deer Evans.
Here.
I don't know if Sonia's gotten into the room yet. Nope, I don't see her. Okay, Jackie Serrano and Sandra Santos.
Jackie here.
I'm here. Good to see everyone.
Robin Henderson and Anderson Dubois.
This is Robin. I'm here.
Oh, and Anderson is excused. Kyle Johnson and Adam Peterson.
Kyle, I'm here.
This is Adam. I'm here.
Judge Gates and Jesus Nunez Pineda. Jesus is excused. Emily Cooper and Dan Toma.
I'm here. Emily, she, her, disability rights Oregon.
Dan Toma, I'm here.
Thank you. Cindy Cecil and Ebony Clark. Thought I saw Ebony come in. Carissa Cousins and Jill Archer.
This is Chris. I'm here.
I'm here, Jill.
Ebony's just chatted that her audio is working, so she's obviously here as well. Ebony, thanks for being here. April Flint Gerner and Annette Magicotami.
Good afternoon, April here.
Hi, Annette here.
Thank you. Dana Hiddle and Andrew Grover.
Andrew's here.
Dana's here as well. Thank you.
Thank you. Alicia Overstreet and Adam Rodakowski.
Alicia's here.
And
Adam's here.
Oh, Adam is here. All right. As we start today's meeting, let's review our shared agreements for how we do what we do in this space. Family and youth are welcome to participate in the meeting at any time. Members of the public who are not youth or family members can speak during the public comment period, which will occur at the end of the agenda, and may contribute freely to the chat. If you have a comment you'd like someone else to read out for you, you can send a private chat on the Zoom through the little chat function to Joylene Carter, Alicia Overstreet, or Annette Magic Otomy, and they will speak it up for you. Our group agreements are to be present and participate in the conversation at hand, to practice respect by avoiding interrupting others when they're talking and using the names and pronouns that people use to introduce themselves with. We avoid the use of acronyms. It happens anyways sometimes. So if one comes up, try to use the chat box to write definition or ask for clarification. It's really helpful for us all to understand what we're talking about. Varied and opposing ideas are welcome. If we have disagreements, we are challenging ideas, not the people who hold them. We work to honor those with quieter voices. If you're someone who doesn't speak up as often, lean in and try to share your voice with the council. You're here for a reason. If you're someone who talks a lot, like I am, lean back and try to create some space for other folks to step into that conversation. We avoid problem solving for individual situations or crises. That is not the role of the council. Instead, we focus on our purpose, which is improving the system of care for Oregon. We try to be mindful of the power dynamics in the room and focus on proposing solutions. I'm also going to review our, I can't get the, SOCAC is using the GARE, which is Government Accountability for Racial Equity tool for decisions on budget, policy, or program. Each time we make a decision, we review what are the racial equity impacts of the decision, who will benefit or be burdened by this decision, are there strategies we can identify to mitigate unintended consequences, and is a completion of the full racial equity worksheet necessary before we move on to make the final decision. That information has been added to our consent process slide so that we have a prompt to remind ourselves to come back and ask ourselves those questions before we make decisions. And I will pass it back to Annette.
Thank you, Anna. Moving on to our next agenda item, we'll have two updates from the Youth Council, Family Council, OYAA, Oregon Youth Addiction Alliance, and other committees as recognized by the SOCAC co-chair. I will go ahead and get an update from our Youth Council. So Cameron, Caleb, and Joylene are going to update us on what's happening with Youth Council.
So I can take this bit. Youth Council is still meeting regularly. We are looking for more youth to join, get involved in all of this incredible work, as well as specifically to fill the one vacant youth seat on full SOCAC's council, which we will talk about later today. So that's where Youth Council is. If there are other youth in the room who want to share anything else, I'll make space for that. Otherwise, I will hand it back to you, Annette.
Thank you. I will go ahead and speak on the Family Council. We have been meeting for a couple of months, Joylene, Alicia Overstreet, and myself, trying to really establish a foundation of a family council similar to the Youth Council. So we have a meeting scheduled for tomorrow. So if you would like to participate, please let Joylene know. And we're really trying to lean on those families with not only lived experience, but who are not represented who are not involved in a system or not in there with the systemy group, for example, an entity that works on behalf of families. We're really more interested in family members who would like to lean in and lend their voice to a solution. Someone often sends an email out that says those closest to the problem are often closest to the solution. So those are the folks that we're really looking for to get involved in the Family Council. So we have a meeting scheduled for tomorrow. To get things going, we're going to just basically start off with an introduction of those folks who would like to participate, and then we'll move into developing how we want to move family council along. So that's just a brief summary. And Joylene or Alicia, if you'd like to add to that, that'd be great.
Well, thank you, Annette. No, I think you did a wonderful job describing it. I think we're really wanting to have family members and family reps, like those of us who are like in the thick of it, doing it on a daily basis. Um, really building this space for us and to help with I guess the overall mission for SOCAC to improve systems for children and youth in the state. Thank you.
Thank you. Thank you, Alicia. Joylene, did you want to add anything? Okay.
No, the two of you did great. And my email's in the chat. If there are any family reps in the room who want to get involved, send me an email. I'll send you the Zoom link. Thank you.
Great, thank you. And I'm not quite sure if OYA or other committees have any updates. If so, just go ahead and raise your hand. That's the Oregon Youth Addiction Alliance.
Go ahead, Cameron.
Oh, yes.
Hey, I don't know if Caleb's here, but just wanted to report that a couple weeks ago we had our first public meeting and it went really well. Thank you to those of you who showed up and engaged. We have our second public meeting this Friday actually because of the holidays. We're hosting it a little early this month. Would love to see some more of you there. And yeah, it's just a really positive space and we're excited for what we're gonna continue to do. Just to remind everyone, we're working with the Alcohol and Drug Policy Commission towards a strategic plan to address youth substance use in the state. So if that sounds interesting to you, hopefully we'll be able to link the information for that meeting to the summary after this meeting that is sent out. And Joylene also has sent it in the chat. So thanks everyone. Hopefully see you Friday.
Thank you, Cameron. And I do have to commend Cameron and Caleb for the work they did at that first meeting. Those are our two emerging leaders. They really did a great job. So thank you, Cameron and Caleb. Any other updates before we move to our next agenda item? Okay, then I will go ahead and turn it over to Anna.
Thanks, Annette. So the first legislative concept that we have to review today is currently called LC 429. That's what they are before they actually become bills as legislative concepts. This one is intended to increase the number of people with lived experience on the System of Care Advisory Council. And I know we had some folks who wanted to speak to the why behind this bill. Joylene, I don't know who's starting or if you're starting.
I'm happy to start.
Okay.
Yeah, so and this isn't really me. Jesus, our one youth who is currently in the governor appointed seat, is not able to make it today. And again, she is the only youth in an appointed position. And so I have this quote from her that she's asked me to share with you all. It says, one of the things that I have felt and heard echoed in youth spaces is the need for more representation at the table. Being able to speak is one thing, but having the ability to vote, to make a difference, is another thing entirely. Having more youth at the table not only serves to cover different experiences from a youth lens, but also to strengthen the connection that youth feel with SOCAC. The more of us that there are, the safer that we feel. So again, that was a quote from currently the only youth who's in a governor appointed seat. So the whole purpose of this legislative concept is to double youth representation and family representation on our council. So instead of having 2 youth seats and 2 family rep seats, we would bring that number up to 4 youth seats and 4 family rep seats, not changing anything else about the council's composition. Thank you.
So the way that it is structured, it would just double what we have currently. So the categories of what types of family members are eligible for appointment and what types of youth members are eligible for appointment don't change. It's just 4 instead of 2. The other thing that is connected to this bill is policy option package, which is a funding request that would add some funding for us, increasing the amount of money we have available for stipends. If we're increasing the engagement we have with people with lived experience, most of them we anticipate would be stipend eligible. So we need to increase our funding for that to make sure we can pay them for the good work that they do with the council. It also includes 3 staff positions. So Joylene's position, Corinna's position are both currently limited duration positions, meaning that they end 2 years from the date that they were hired. This legislation would make would give us what's called position authority, meaning that we're allowed to turn those into permanent positions, and would also provide the funding to pay for those staff positions. It would also give us position authority for a public relations specialist and funding for that person. One of the things that we've consistently heard across the board is that we need to improve our communication strategies and skills. And so while we're engaging with communication consulting from Portland State University, we need a person whose job it is to make sure we're communicating clearly and effectively with the whole host of different partners and collaborators we have across the system. So it's about $500,000 additional funding for the council. And it is included in the governor's budget. So that's great because it shows that this is a priority for the executive branch, that we get fully funded and fully staffed for our work. I saw a question in the chat. If appropriate, can you share how much of the youth and family stipend we are setting one up for an advisory council we have on the evolution of youth residential care? The stipends for the System of Care Advisory Council are legislatively mandated, and they are exactly what the legislature, each member of the legislature receives for their per diem amount. That amount goes up every year on October 1st and is currently $178 for each day that you provide 1 or more hours of work. It's very confusing. For some of our members, right? You're not paid by the hour. You're just paid if you did an hour or more of work in a day. We're currently averaging about $16,000 a month in stipend expenditures, and we're expecting that will be going up to around $20,000 or more a month as we continue to build the engagement work that we've done with Youth and Family Voice and the Oregon Youth Addiction Alliance and all of the other stipended activities that we have. So now is a time to ask questions or make comments for SOCAC members about whether we like this bill, if we want to change anything about the bill. What are your thoughts? Members, feel free to raise your hands and I will call on you, or just unmute. Emily Cooper.
I wholeheartedly support this bill. I think Jesus said it well. I also am reminded of a long-standing saying in the disability rights community, nothing about us without us. And this exemplifies exactly that. And I think, participation is one thing, but Jesus, her words are really powerful. There's participating, and then there's having a seat at the table voting. And so I think this is fabulous, and I'm so glad we're doing it.
Thanks, Emily. Jackie.
Yeah, I want to second that and just say that I think I wholeheartedly support this and really like to focus on bringing families to the table who are in rural and frontier communities. I really hope that we can really target that area, bringing family members or parents' voice who are in areas outside of metro areas. I think that would be a big goal.
Awesome. Thanks, Jackie. Robin Henderson in the chat definitely supports the concept. Any other questions, thoughts? Are we ready to walk into our consent process on this bill?
Anna, if it's all right, I'd like to make some intentional space for our two governor-appointed family reps, Alicia Overstreet and Annette Magicotami. I know your voices were very, very helpful in creating this bill, so I want to make some space if you have anything to add. And no pressure if that's a call out.
I don't think I have anything to add. I just appreciate just having the ability to add more family voice to these conversations. Sorry, I'm a little sick, but yeah, I appreciate it.
I would reiterate what Alicia said. It's just a good step forward to making sure that family and youth voice is heard. Thank you.
Thanks. More support in the chat, and Sandra Santos mentioning that she would love to see representation from youth with lived experience in the juvenile justice system. I think we are getting to a place where that is a possible option. I know we have one application that was recently submitted from a youth who has lived experience in the juvenile justice system. And we are working on one of the things that was in the original statute was some language that was stigmatizing to that population of youth. And so the bill changes how we describe what it means to have been in state custody from having been a ward of the state to just defining having been in foster care, having been in juvenile justice, right? It is the same thing, but it isn't as off-putting for the youth on our youth council who were like, I would never apply for it when it's described in that way. And so we're trying to just be a little bit more welcoming in the words we're using to describe the spaces, which turns out makes a difference. Okay. Oh, why do we need this? Jolene, did you want to speak to this? I'm sorry. I should have remembered we had this extra slide.
Sure, I'm happy to. And I will start by just saying that this is not any one person's experience or lived experience being a member on this council representing youth or family members with lived experience, but it's been a lot of data collected over time, which contributed to this. So some of the youth and family representatives might feel like their voices are overshadowed by many of the other system leaders and providers. Paraphrasing on my own, it takes guts to speak up in a room full of executive level or higher professionals in the system from a place of your own lived experience, right? So that has led to feelings of intimidation, a fear of retaliation, which is very, very valid. If they are living the experience, it's not something in the past, and they speak up using their lived experience to benefit our work. Some of us in the room have the power to retaliate, and so there's power in numbers here. I will also say that increasing that number of youth and family will help SOCAC better assess the effectiveness of services directly from users, right? No one system user's experience reflects all of Oregon, and that's a massive burden that we are asking folks to carry when there's only one or 2 people with lived experience representing all youth and families across the state. So doubling the amount of youth and family reps on the council will increase the voices with lived expertise who have voting power. So we have lots of folks showing up to these tables, but it's very different when they are only able to speak up or comment in the chat, like and react. It's different when you have the power to actually vote. And it also reduces the stress on current members, family members and youth members who feel like they are expected to represent all families and all youth in the state with similar challenges. Thank you, Anna.
Thanks, Joylene. All right, are we ready to take our consensus process? Does anyone have an identified racial equity impact that they think we should name as we move into our process? I don't know why Jackie's become the champion of therapeutic pause, but I'm looking at you to make sure I'm leaving enough time for people to respond before moving to the next question.
This is Dan. I think that having more seats allows for a broader range of racial, ethnic diversity. So I think that's a positive thing.
Thanks, Dan. Is there anyone who will benefit or be burdened by this decision?
This is Emily. I think youth and families will benefit from having a seat at the table, but we will benefit from really holding space. I think as a council, I think though I'm mindful of Joylene's point about the burden of power and carrying and representing a group of young people.
Thanks, Emily. Do we need to talk about strategies to mitigate unintended consequences? Okay. Then I'm not feeling like the racial equity worksheet is necessary. I would invite anyone who does feel like that is necessary to raise your hand, send a private chat to Alicia or Annette. Let them speak up for you. If you're Alicia or Annette and you feel like that's the case, you can send a private chat to someone else to speak up for you if you don't want to be the one to say it. Want to make sure that we have full opportunity to fill out the worksheet if anyone feels like that is the appropriate next step. Okay. First step. Thanks, Alicia. Nothing came through to Alicia in the chat. Does anybody feel like they need to take a stand and block this bill from becoming a SOCAC legislative concept? Okay. Does anyone have reservations they would like to discuss? I know this sometimes feels silly when we all agree on things, but it's important to use the process every time. Anyone feel like they need to stand aside? Okay. Now's the time for you to raise your hand if you are an appointed member of the council and you agree this should be one of the SOCAC bills for the 2025 legislative session.
Just for the record, Anna, this is Adam Rodakowski. I'm driving. I vote to approve.
Thank you. So I have yes votes. We just went to a public meeting training. Apparently we're supposed to name out everyone's vote, so we need to follow that rule. So I have yes votes from Robin Henderson, Adam Peterson, Andrew Grover, Emily Cooper, Jackie Serrano, Annette Magicotami, Allison Stark, Alicia Overstreet, Dan Toma, Carissa Cousins, Jill Archer, Kyle Johnson, Ebony Clark, Dana Hiddle, April Flint Gerner, and Adam Rodakowski. Sandra, did I miss you?
No, I couldn't figure out how to put my hand up, so I put my thumb up and I think it went down, but yes, I'm a yes.
Okay.
Sorry.
Thanks. No, that's fine. Is there anyone else, appointed member of the council who hasn't voted? Okay, well then Elsie, what was it? 3, I've already forgotten. LC 429 will be moving forward as a System of Care Advisory Council bill. Kyle, is that a hand up to talk or is it just lingering? Okay. Okay, well, I thought this would take longer, to be honest. So we are like way ahead of schedule. I don't know that it is helpful to move into a break right now. Annette, what are your thoughts?
No, let's just continue on with the agenda.
Okay.
Yeah, we don't need a break. We'll take one, I imagine, 2:30-ish, something like that.
Okay, that sounds good. One note that's not on the agenda, I just found out about it this morning. The governor's office, Rachel Currens Henry, and formerly our own Amy Baker, now the governor's behavioral health initiatives director, will be joining us around 2, and they want to speak a little bit to Amy's new role and the work that they are. Some of the information in this bill, and so we may have a weird pause when they come in. We back up a little bit for them and then go back into the contents that we're talking about, but we're just going to pivot and go where we need to go. So legislative concept 346 is an omnibus regulatory reform proposal. Robin Henderson, I don't know if you want to kick us off as chair of our legislative committee, or if you would like me to give the how we got here background.
Why don't you go ahead and do the how we got here background, and I'll tag on the end of you. How's that sound?
Sounds good to me. So as you all may recall, we had a legislative concept that we had discussed in this space, and it was going to be a $20 million ask to the governor's office for the legislature to send SOCAC $20 million to work with DHS, OHA, and the Youth Authority to enter into contracts on behalf of kids who have complex care needs in order to be responsive to the suggestions in the Special Master's Report. As we worked through that concept with Legislative Counsel and the Department of Justice, it became clear that it was not possible for us to do that. We don't have the authority. We can't enter into direct service contracts on behalf of other agencies. There were a number of sort of procedural barriers in the way for us to be able to do our what we had kind of referred to as a $20 million Band-Aid on the system. I'm just going to tell the truth. I got really mad because I am tired of watching kids suffer because they can't get through the door. The doors are too narrow for access to care, especially for complex kids in Oregon. And after the death of a young man in temporary lodging in late summer, I called the governor's office and just said, I can't keep doing this. I can't keep watching this happen. This was predictable. It is likely to repeat based on the structure of our current system. And I'm really, really frustrated. So what is it you want me to do? The governor's office said, I feel like we have a council that was created to make policy recommendations for solving problems like this. Maybe they should make some recommendations. And so they assigned Michelle Pfeiffer, who does government relations at DHS Child Welfare, to work with the council to figure out what are some of those recommendations. What we did in those conversations was go back to the safety work group report and all of the work that was done in that space through the council and our subcommittee, and go back to youth and family that we had connections with who had spoken up about some of these issues and ask them what would need to be different about the system. They told us a notebook full of things that they needed to see different about the system. And then we went to providers and we went to agency folks and said, how do we make these changes in the system that youth and family are saying need to be done? That is what became LC 346. It's a very complicated bill. It is 91 pages long. There are definitely some mistakes in the drafting that we have been finding as we've been walking through the conversations with the council and other collaborators over the past few weeks since the LC has been available to us. So we'll see some proposed amendment suggestions at the bottom that are hopefully going to clean some things up. But the intent is really to take what is Oregon's gold standard for regulation of the children's system, maintain that gold standard and tweak some things so that we can make sure the doors are big enough and wide enough for kids who have complex care needs to get into the services they need, ideally at the lowest level. I mean, always at the lowest level that's possible, that's medically appropriate. There's also some cultural implications to some of this stuff that we'll dive into. So sometimes a service that might be medically appropriate isn't culturally appropriate, and we actually need for services and supports to be both. So there are some ways that we're trying to address that in this legislative concept as well. Robin, is there anything else you would add to that?
No, I think that covers it. It was a fascinating, a very fast, very fascinating process to engage in. I had the opportunity to sit with many of the providers, including folks from juvenile justice, OYA, and schools, to talk about some of the impacts that you're going to see outlined in here and to hear their stories for an entire day. And it was a very humbling experience. I know Anna had the opportunity to sit with many system affected youth and hear their stories, and that has been something that has weighed very much in how this bill was designed and the things that we've been thinking about. I also had the opportunity to go to a forum. Adam and I went to a forum hosted at DHS involving all of the agencies. There were probably 75 people in the room who really thought about very thoughtfully the impacts, the consequences, the challenges, and all the things. I've never seen a collaborative process like the process that put this together. And I do want to give a special shout out to the incredible work that Michelle Pfeiffer put in on this. And you can see how she took such great care to translate what youth and family told us they wanted into what fits into a policy that we can put in statute. And sometimes it looks and reads like an agency bill, but that's because that's how our statutes are written. And so I hope that we can, through the stories that you're going to hear from various council members, see where the youth and family voice informed where the policy came from. And I hope that we've been true to that. And if we haven't, let's deal with it.
We have an opportunity to make it better, right?
Yep.
All right. So we sent out I think the week right before Thanksgiving. Hopefully folks had some time to dig in. I know I met with a number of you to talk through the policy brief and the legislative concept, just to make sure that you were able to kind of process through it. Some folks do that better in dialogue. April Flint-Gerner.
I just saw Michelle's come off mute, and I wondered if she was trying to say something in response.
Thank you.
Oh, sorry. Yeah, I just wanted to highlight before we potentially forget this, or I was going to try and make a note of this. We do anticipate the critical incident review team report on the youth who died by suicide in the end of this summer. Those recommendations from what's called a CIRT, so that critical incident review team report, that came out a couple Fridays ago. Those recommendations are currently going through the governor's office is having those go through the sub cabinet for recommendations for what is going to be put into a bill. The thought is that those recommendations we would have to drop them as separate bills, but during the beginning of session, they would be combined into this omnibus bill. So we do not talk about those recommendations yet here, but those would be things we would be coming back to the System of Care Advisory Council to definitely talk about, and would be kind of amendments to come later. So I just didn't want that to be lost because I know, you brought up the impact his death had on you and kind of this work, and it was it spurred a huge collaborative effort amongst state agencies to prevent that from happening again. So I just wanted to highlight that's also coming and kind of part of this.
Thanks, Michelle. And it's important to sort of recognize there that those amendments would be sent by the subcabinet to the legislative committee for consideration. So the legislative committee would be sort of the deciding place as to whether those amendments are added into this omnibus bill, if the SOCAC ends up running this bill, or if we would say, good luck, DHS. You can run those bills on your own without us. Questions or comments on that? It's kind of an important decision point. Okay. So back to the background. There have been, as you saw in the policy brief that you were sent, a number of bills that were passed in the last decade to improve regulatory oversight of the child caring industry or child caring providers in the state of Oregon. And when we talk about child caring agencies, that's an important terminology. It means specific types of services. Michelle, are you on it enough to name out each of the types of services that fall under the CCA, Child Caring Agency designation?
I could be pretty close. Yeah. So this is all of our residential care settings, our shelter and runaway youth programs, academic boarding schools, therapeutic boarding schools, day treatment care, proctor foster care, or if that makes it like therapeutic foster care for kids. I think there's 8. Gosh.
We had outdoor programs, but we don't
we don't have any more outdoor youth programs, but the outdoor youth programs and our secure transport agencies. I think those are the 8, if I can remember right.
Thanks. So I think sometimes you hear child caring agencies, you think of like a young person's daycare. That is not what we're talking about here today. So, and like I said earlier, we set the gold standard in Oregon for how those entities are regulated, identifying things like restraint and seclusion, which are abusive, and identifying how to know that those things are abusive, how to report that they're abusive, how to investigate whether abuse happened when a restraint or seclusion takes place in one of those facilities. I think it's really important to state that the intent of all of this work is to never decrease the amount of child safety that we're guaranteeing in any of these settings, and to make sure that we're really, really prioritizing quality care as we're trying to improve access to care. We've seen some of the unintended consequences. I think what maybe happened is that some of these regulatory bills passed, they layered on each other, and maybe there were some interpretations that we ended up more strict and more strict in terms of how we were enforcing some of this legislation. So what we have seen as a result of this layering and restrictiveness is reduced provider capacity. We have fewer beds. We have fewer facilities. We mentioned just a second ago, we no longer have any outdoor treatment programs existing in Oregon. People can have their opinions about whether that's appropriate or not, but it is a fact. We've seen challenges with workforce recruitment and retention. There are a lot of folks, and I don't know if anyone is on tap to speak about this, but liability-driven reporting of incidents. So folks calling into the Oregon Child Abuse Hotline and saying, I don't really think this is abuse, but I think I have to report it, or I'm worried I'll lose my license. And that is not a very useful way for our child abuse investigators to be spending their time logging and tracking all of those reports that folks are calling in to say, I don't think it was abuse. We've also seen significant delays in accessing care for youth with specialized or complicated needs, as well as some kids simply, we've talked a little bit about a donut hole where you're too complex for all of the settings, but not complex enough for state hospital level care. kids getting kind of stuck in this gap between what systems feel like they can provide and what they actually need. So as we mentioned, going back to the safety work group report, trying to take the priority from the council of looking at the special masters report and the recommendations, and then the temporary lodging conversations and policy recommendations that have been coming out, and figuring out what is it that we need to tweak with regard to our current policy environment to improve access to care and maintain safety of care. And I think this slide is Michelle's.
Yeah, so as Anna was explaining, there has been a lot of discussion about child care and agency regulations, and really Senate Bill 1515 from 2016 did some tremendous work on enhancing the regulation and oversight of our child care and agencies, and also added new definitions of child abuse specifically to children in care. And the definition of children in care are those who are residing in or receiving services from a CCA or a foster home or a DD setting, a developmental disability services setting. It's not, I know that sometimes it can sound confusing because like some people could interpret that could be a child in care as somebody specifically in child welfare foster care or in the state's care. And it is not that. It does include some of those youth, right? But it can go beyond that to private insurance paying for a placement that is medically necessary and appropriate treatment in a child caring agency. And so those broaden the definitions of physical abuse, neglect, sexual abuse, and added unique categories for protections of those children with financial exploitation, verbal abuse, wrongful restraint, and wrongful seclusion. You go to the next slide. What we have seen really in CCAs, and this is data provided by Otis, is that prior to the passage of that legislation in 2016, we still received a significant amount of child abuse reports, and our assignment rate, though, was about 41%. So that means that a lot of the calls that people were calling in, there were genuine concerns about child abuse as defined in our statutes. After the passage of Senate Bill 1515, we saw a pretty significant spike in calls to the child abuse hotline with reports. Did also see a spike in assignments for that first year, and then things kind of started to regulate with assignments after that. But with, again, we had another increase that's likely attributed to the passage of Senate Bill 710, which we'll get into later, which is about redefining what wrongful restraint and wrongful seclusion are. And we are now with 2023, the number of calls that come in, we're at about an 8% assignment rate with Otis, which I think this doesn't necessarily have direct cause and effect, but I think there are significant correlations here. And really, when I look at this, I see this as kind of what is this indicating to our system, and kind of put that together with what we're hearing from those who are actually making the reports. And what we know from those that are making reports is that it's kind of the combination of multiple things, that the new definitions of child abuse and care, the heightened liability provisions, punitive licensing actions, and establishment of official misconduct charges for failing to report all created this heightened sense of liability and concerns for not reporting something, even if there is not reasonable suspicion that it is child abuse. They would simply rather report, and through this avenue, even if, so essentially it's like all liability driven. And so kind of what we're trying to figure out and is how do we look at right sizing this, giving the workforce the confidence that they need to know when they're supposed to report something as child abuse to the child abuse hotline, when something can be appropriately reported to licensing or in another avenue for accountability and oversight when there is a concern, because this does create a situation where there our safety concerns at our screening, at the point of screening, because there's valuable time and resources spent on screening these thousands of reports when we are having to sift through what people are reporting simply because it's a liability report rather than when they are genuinely concerned about child abuse. And so for the Otis screeners to go through, they're going to have to sift through all of those reports and try and figure out which ones are the ones that reporters are actually wanting me to do something about today. They're genuinely concerned about a child's safety in their placement or where they're receiving services. So one of the solutions, if you could go to the next page, and working with both the subject matter experts within the licensing and regulatory environments within ODHS. I guess you can go to the next one, sorry. And oh, nope, sorry, go back. I thought there was another one. So working with licensing and regulatory environments within ODHS and collaborating with providers was really trying to look at what amendments take us a step forward in addressing some of that heightened liability environment. And this really brought up the concept of just culture, which I think is spoken about in the safety work group report, and trying to figure out kind of what elements of just culture can we start embedding into our regulatory responses, while also ensuring that the regulatory tools are not diminished that would impact child safety. So this is essentially the proposed solutions are to define agency management. This is a one that's it's more technical. Right now, there is like, if the CCA or the child caring agency fails to do X, Y, and Z, and it becomes a question of interpretation of, well, who is a child caring agency? Is that just the management staff? Is that a line staff that fails to do something? And it's important for us to clarify this because there are points in statute that say if the child caring agency fails to do X, that can result in automatic revocation or suspension of their license. And so clarifying that is helpful. So we added a defined term of agency management. When we have seen with our licensing actions, the programs that we have taken action to suspend or revoke their license, there have been issues all the way at the top with agency management. There are very healthy programs that have issues with line staff, and they are very quick to act on them and take HR action to ensure the safety of the children. And that is a sign of a healthy organization, and it's not something we want them to be concerned that they're going to lose their license over something that a line staff potentially does. The broadening of mandatory action. So like I said, there are specific requirements today that require the suspension or revocation of a child caring agency license. This broadens it to align with other settings to include placing conditions upon the license. So it's not only you lose your license, there is one option to be able to work with the program to continue to have them function within our system of care. Eliminating official misconduct language. This language is specific to ODHS employees. It does not extend to any other state employees. And so the action or the failure to take action being required to be official misconduct by the department or department personnel, again, is part of a punitive culture instead of kind of that just culture of being able to have a learning system. Obviously, still being held accountable if somebody has, acted inappropriately in their job. And then lastly, for this section, clarifying reporting process throughout statute. Right now, it could be alluded that you could tell anybody within ODHS about a concern about a child caring agency, and that could potentially be your way of making a mandatory child abuse report. And that as soon as the agency is aware, that we are then liable for taking action. It's a really hard thing for an agency of thousands of people, which also include people that have nothing to do with child abuse or child welfare. We have people with vocational rehab, we have people with publications, we have financial people. And so we want to make sure it's very clear in statute that mandatory reporters or people concerned about child caring agencies or child safety should be calling the child abuse hotline. So we just make that clear throughout statute. Thanks, Anna.
Thanks, Michelle. That was a lot. I know we had planned to pause for questions in a couple of slides, but I wonder if it's okay if we pause now for some questions around the liability-driven child abuse reporting adjustments and why I think it was alluded to, like why a just culture for staff translates to better care for kids. Does anyone have questions about this slide or the wealth of information Michelle just shared with us, or the last few slides? It's okay if you don't, but I just want to break it up and make sure we have time for conversation throughout.
Well, one thing as looking at the data slide, you don't have to go back to it, but as I looked at that, it appears to me that even when in 2016, when there was an increase in investigations, there was still not an increase in substantiated allegations, which is because you can see that spike in the blue line there when there's the big spike in the green one. More reports. For that 1 year, there was a significantly higher number of actual investigations, so they didn't just get closed. But there was no increase in substantiated findings. So that seems pretty important to me. That seems meaningful to me. I don't know.
Andrew, one of the things I want to highlight for this slide that's difficult to show is that, yes, you are right. There's not the same type of significant increase. But what is challenging when you have such small numbers is to be able to show some increase with the yellow line being the total substantiated allegations. They're just so much smaller than the thousands of reports that were received. So if that makes sense, if that makes sense. There are some slight variations within the yellow line that look much more flat given the optics there.
Thanks, Michelle. Dan?
This movement from punitive culture to a just culture sounds foundational. I just Googled just culture because in my ignorance, it's not something I was aware of. And so I now know about one sentence worth of that, but I wonder if it would be helpful to give a brief overview of what that foundational element is.
Michelle, is that something you're able to speak to? I know it wasn't on your list of things to be ready for, but I also know you've been thinking a lot about it. I'm happy to take it if you don't feel confident, but
I am happy to start it, and then Anna, if you want to add anything to it. There is a great YouTube video that I would encourage people to watch on it that helps explain it in more simple terms. But essentially, as I understand it, it is what we've learned through system change and learning is that when we create a punitive structure that results in fear and liability-based decisions, that ultimately we're not creating a system to be able to have transparency and openness about issues, mistakes, gaps in our system, and how to holistically address them for future benefit of the system and safety of children. I don't know, and if you want to speak more to essentially it is foundational. You're very right, Dan, and how we shape our system. The best analogy that I have with child welfare is our critical incident review team. It used to be quite a punitive and scary process for staff to engage in. When there was a bad outcome, whether it was a death, near death, or some other kind of heightened situation with the child. And it was a difficult process to engage with, and often resulted in people feeling like they were going to lose their jobs, and really impacted the workforce and didn't create the type of conversations that needed to happen about how did this happen? Like, how did these decisions get made? How did something get missed? Whatever the dynamic was, to be able to address it with full transparency, and not have as much fear. So, Anna, do you want to mention more?
Yeah, we dug in on just culture in the safety work group conversations, and I also had done a lot of this work when I worked in the domestic and sexual violence field. And it's when you're working in a crisis-based setting, which is like deep, domestic and sexual violence is like always crisis. But in a child caring agency, you have crises that are unpredictable, right? A young person gets stressed out, blows out, whatever it is, right? And the opportunity for a worker who is faced in that moment with a crisis, when they are working in an environment that is a just culture, they have more availability of their frontal lobe to actually pause and engage with that young person from a relational standpoint. When they're operating in a more punitive environment, their brainstem is more likely to be the thing that gets involved in their response to that crisis in front of them. And so you actually see a calmer response to a young person in crisis in a facility that has a just culture, and opportunity for other folks to get engaged and prevent that crisis from getting worse. Whereas when someone comes at that young person who is in crisis themselves with crisis in their own crisis, responding to it, you exacerbate the level of stress and tension and fear in the room. And especially in a setting like a child caring agency, young people are looking to the adults in the room to create co-regulation. And when your brain isn't capable of co-regulating because you're operating in an environment of fear, you're actually not providing the same quality of clinical services as you could be if you were in a sort of a safer place from an employment standpoint.
There is a lot of work going on about this. I know that April has mentioned it to me in the child welfare space in general. So I don't know if April, you want to add any to that really short. I know that we kind of gone over on just problem one of many things that we're talking about.
Yeah, I'll just say briefly, I was going to throw it in the chat, and I see that there are other hands raised, so I'll keep it brief. But there is some really solid research around professional dangerousness that really says that unless you can create an environment where your workforce has an opportunity to reflect on their work, get out of their lizard brain, and really engage, you're more like families are more at risk. Children are actually less safe in environments with a workforce that is constantly worried about their own safety. And I'm talking psychological safety right now. And so the recommendations for years have been to create the kinds of safety culture work that are happening around our critical incidents right now. Again, I think it would be a very interesting conversation to invite in some of our safety culture partners from University of Kentucky in at some point to talk about that data and how we support the workforce in that way. But the other thing is to implement coaching models so that people are learning as they grow about how to do really critical work with families, and that they become more solution focused, using things like appreciative inquiry, those kinds of things, rather than there's a yes/no answer for everything and I'm to blame. It absolutely puts our workforce on their heels. And so we've been looking at lots of ways that we can bring more safety science and safety culture into child welfare in particular, and then highlighting how, the secondary trauma and the places where we are not recognizing that we are contributing to professional dangerousness is actually kind of the antithesis of the work that we want to do. So anyway, would love to nerd out about that at some point when we don't have a huge LC to get through, but appreciate that summation. Michelle, you did good.
Thanks. Emily Cooper.
And so I'm also I'm concerned about this LC, but I think just on this, in terms of looking at Otis as a basis for this, I would propose another solution here, which might be like, does Otis need more training, more resources to actually do the screening and the investigations? So, when I've worked with Otis, it seems like a lot gets closed at screening, primarily because they're trying to triage exactly what we're trying to triage. So to me, when you think about a problem, you think about where the source of the problem is and how to achieve it. And so to me, this is a wrong change for the right problem. We need to look at, how to increase the education and training and resources for Otis. And when you look at the reduction of child caring agencies, what I understand is a big part of that was provider payment. And what's really amazing, and maybe we can flag it when Amy's on later, but in the governor's budget, instead of a provider payment being one time, it's going to be ongoing, so that providers are more incentivized to serve this population because they're actually getting paid a competitive wage, or they're actually able to staff things in a right way. To me, it would be a much better use of this council's time and a much more positive impact on the lives of the youth that we're charged at being focused on, to say, how can we make sure that providers have the right resources, the right training, the right staffing ratios, rather than watering down definitions of abuse and neglect out of fear of liability. That's my concern with where we are right now.
Thanks, Emily. We can
Sorry, may I just speak to that briefly? Hey, Emily, it's Adam. So while I see your perspective and understand that's where you're coming from a provider who is doing this work, it is tough to recruit and retain staff who, while are not founded for child abuse because they haven't done anything wrong, are still investigated so frequently and under this presumption and concern that any wrong move that they make could end up with them as a child abuser, makes it really hard to staff programs. And I know that I'm not alone in the provider community when it comes to that. And so while rates are an important piece, right, that allows us to do better training and better staffing ratios, there also has to be a regulatory environment where our staff aren't fearful to do their job, or simply choose not to come to this field in the first place because of that. So I just wanted to say that.
I also want to highlight for this section, we have not talked any bit about child abuse definitions. This is simply more of the regulatory response to issues, is more of a just culture response. So I think when we talk about, like when you say watering down definitions of child abuse, are you referring to, Emily, the proposed changes to restraint and seclusion that we'll get to later?
Yeah, I was mostly responding to the title liability-driven child abuse reporting. And so instead of looking at the reporting piece of it, how can we go upstream and support providers better with resources, training, better ratios? And so instead of getting so far down the path where it's someone scared to serve a client because there's 8 youth in a milieu and that's only them, how can we go upstream? To me, that is worth a lot of serious conversation.
Alicia.
And can I
Alicia, you're muted.
I was gonna say Adam can respond before I.
Okay, Alicia or Adam and then Alicia and then Robin. And then we'll move on.
Yeah, I can just give an example of the liability-based reporting. As a child caring agency, we had an incident that occurred and we reported timely to our licensor, and they asked if we had reported it to the child abuse hotline, and we said no, we don't have any reasonable cause to believe that child abuse has occurred, so we didn't intend on reporting it. That's why we reported it to you as a licensor. And their response from the state of Oregon was that they had given me an opportunity to report, and that now, basically whatever happens, happens. And so it was essentially a veiled threat that would have resulted, if there had actually been child abuse, in a revocation of our license to operate as a child caring agency, when we reported to the state immediately what had happened. And it was closed at screening because there was no allegation of child abuse. But the agency essentially said, okay, well then, if this happens, you will lose your license if we find something there. And so that's the liability. Yeah, and Jill, exactly. I run a treatment foster care provider. I'm a treatment foster care provider, right? So like that would have impacted the 50 kids across the state. All those homes would have lost their licenses to operate as a result. Kids would have been displaced from all across the state that had nothing to do with an incident on one home. And so those are the sorts of things that I see happening as a provider doing this work every day.
Thanks, Adam. Alicia? And then I think Robin wants to tell us we need to move on to the next section.
Yeah, I think overall, and I guess I wanted to stick to the regulatory kind of piece. Is there a reason why rather than updating the rules to clarify some of these things, there is a need for a new law? Does that make sense?
Yeah, I understand what you're asking, Alicia. And because this stuff is the law. So we can't just make rules to make the law not be the law. You have to actually go to that legislative change and adjust the statute.
Okay. Okay. Yeah. And maybe my question would be more appropriate when we get to the definition of abuse and whatnot. But I think okay. Makes sense. Appreciate it.
Yeah, thanks for asking. Robin?
Yeah, you called it. I'm gonna keep us moving here because this bill, and we didn't frame this, we jumped right from background into talking about the bill itself. And I wanted to frame the conversation, so I'm gonna take 2 seconds and frame it. In this bill it's a bill in its totality. So when we get waylaid taking apart a piece of this bill, we are missing the totality because some of the issues that folks are bringing up are actually touched on in other parts of the tweaks. Anna's correct. Everything in here is about statute that we could not shift in rule because there are very small changes that do often have. I know, I love it. We do jump right into it. You're so right. But I want to make sure that we get the whole, as opposed to just the pieces parts. So I'm going to keep us moving, and remind us also, Emily, I want to apologize for that use of the term liability driven. You're right. That's a bad summation of that section. And I will completely blame the AI system that helped me create and help put this piece together and summarize things. I should have caught that, and my apologies for that. So that's not the totality and not what we want to present. Michelle, can you quickly walk us through this portion, and then we're gonna summarize this section and move on?
Yep. So really, the next section, it's not the best title here either, but there are some very rigid requirements and regulations within statute on child caring agencies, that there is an ask for a little bit of flexibility on. One of those is right now, child caring agencies have to be a corporation. This particularly, we're hoping to get a very limited exception to this. We had a youth who was placed out of state this summer, and we'll get to a little bit of that situation later on. But we were unable to license that facility out of state. They were a LLC in the other state, and that was the requirement of the state, which is a limited liability corporation status. And so we're looking for specifically to increase our ability to license programs out of state to have an exception. If they are only required to be an LLC in the state in which they operate, to be able to make that exception so that we're able to license those entities in compliance with statute. So that is one of them. Right now, we have a very limited exception to the professional financial audit exceptions that CCAs are required to do. We're simply asking for a technical fix for adoption agencies to be removed and to be any similar type of agency. So we don't have to ask for statutory change in the future if another type of CCA comes up. Does LLC status exception only apply to out-of-state placements? I think that's the plan right now. I don't know of licensing having any other issues with any programs other than out of state. But that's something that we could explore more or have conversations as rule is written by the department of who it can apply to and those limited exceptions. Clarifying investigation procedures. There's a term that's used throughout. This is really trying to align terminology. The word investigate is used throughout. We really tried to change language so that if investigate is used, that it is primarily used only when it's about a child abuse investigation. If it's another type of state action, it's like assessment or some other kind like review or some other kind of language. Improving notification requirements. This is also a very technical thing. It's just taking out the very cumbersome language in statute that essentially identifies a unit that was established by Senate Bill 1515 to very more concise language. Aligning quarterly reporting is really just trying to get to these key issues that could trigger a condition on a license, revocation or suspension of a license of a CCA, that those be the elements that we report on for the quarterly report, rather than kind of, we have a bit of a mismatch in our quarterly report right now with what we're indicating. And then lastly, there was agreement that there's civil penalty language that was added by Senate Bill 1515 that has never been used. That was asked to be removed, and the state had no issue with that since it has never been a tool that has been needed to be used. It is also a bit in conflict with the fact that we are continually asking child caring agencies to take care of children who we need to avoid being in temporary lodging. And so having something hang on them that would be a civil penalty for saying yes to one of those kids is a bit in conflict with what we're trying to do in some of those circumstances. So those are the kind of the other little key regulatory changes to increase some flexibility in statute.
Okay. Well, Emily, I see your hand up. We're going to hold questions and get through a couple more slides. If you want to just make a note so you don't forget it or whatever, I want to make sure we hear from you. Robin, is this you?
Yeah, so this is the wrap up in this section. Every one of our sections takes a look at the anticipated impact to the 9 federally recognized tribes of Oregon. With this section, we don't see immediate impact to the tribes, but we do see the benefit of refocusing child abuse reporting on child safety and how that can help reduce the disproportionate representation of Native American and Alaska Native children in child welfare services. So that is a positive outcome that could come. Wrapping this section, Emily, you had the first question.
Yeah, and so understanding that this is just for not making out-of-state facilities corporations, what I'm concerned about is some of the history, terrible history we know about private equity in this child welfare and child behavioral health space. I have been to some of these places and out-of-state places. In Idaho in particular, they're licensed as oh God, it's not even a child caring agency, it's a daycare provider. And I met with a young person who had a broken hand and had not seen a doctor in the 4 months they had been there. And I'll put in the chat some investigative journalism that has happened around in this space. And so I understand that the intent of this is to expand some flexibility and making sure youth get to the right place, but I don't want to expand it so much that we're creating an opportunity for private equity providers to step in to serve this vulnerable population when they have a terrible track record in serving this population.
I couldn't agree with you more, Emily, in terms of the concerns about private equity. I think that there are other mechanisms for the private equity conversation. I'm extremely concerned because private equity right now is coming into Oregon already. And they're coming in through a proposal that's coming in through one of the major hospital corporations to have a freestanding facility that's going for a certificate of need to build a 90 plus bed facility in Lane County. I don't know that using this I think we need to have serious conversations about how we stop private equity health. Full stop. And I don't know that using these regulations, which right now are driving our local provider community out of business, is the mechanism to get at the answer that you're asking for. Because I can go there. I am firmly wearing my psychologist member of the SOCAC hat saying I have concerns, the exact same concerns. And my concern is when we lose all of our providers in Oregon, that's all we'll have left. And that concerns me greatly.
Alicia.
This might be a really stupid question.
There are no stupid questions. If you don't know the answer, someone else probably doesn't either.
But, thank you. What is there a difference between private equity and an LLCs? Or is that kind of like the same thing? Or are we just talking like two completely different languages here? So I want to just kind of like recenter the language so that we can all hear the same thing.
Yeah, so LLC and corporation, those are types of businesses. An LLC is a limited liability corporation. It's typically set up like in a smaller business so that the owners of the business are protected from some of the legal liabilities if they were just if they just did the thing their business was doing without this LLC license. Corporations are a different sort of legal structure. They also create, you have to have a board and there are things you need in order to be a licensed corporation in Oregon and they're slightly different from an LLC. So they're typically corporations have a lot more administrative structure to them than an LLC. And then private equity is a whole different ball of wax. What that is a funding mechanism for the types of services that we're talking about. So the way that Oregon has historically funded our services is through insurance, Medicaid, and state general fund, federal fund matches, those kinds of things. So publicly funded or insurance. What private equity funded services is an individual group of investors deciding we're going to open. It's very common across the country in older adult care. They're like, we're going to buy this retirement community and run it for a profit now. And there's like evidence all over the place that quality of care goes down, staffing ratios go down, because you're still funded through the same mechanisms as before, whether it's Medicaid or private insurance or whatever. But now you're trying to maximize for profit instead of for good outcomes for the people you're serving.
Right. So kind of like former asylums and things like that, like we used to have in certain states.
Yep. Yeah.
Okay,
We're seeing that dynamic all over in elder care, and it's now coming into youth behavioral health care. And it's frankly kind of terrifying.
That makes sense. So I guess my question is that if private equity, like Emily, I think put in the chat, can't do the services right now because they're not a limited liability company, are, and I guess earlier my question was around like if this LLC exemption only goes for out of state. Does that mean that LLCs in the state of Oregon can't get licensed either?
That's a great question, Alicia. And this has actually been an interesting point within the state conversation because there are providers within the Oregon Developmental Disability Services that can be LLCs. And it has been an interesting friction point as we have looked at them to provide services for children in child welfare care, maybe experiencing temporary lodging or preventing temporary lodging. And when kind of the exploration of what does it look like when you are simply a service provider, like a direct support professional, for example, that can be an LLC. And could there be an equivalent where you don't have to change your whole corporation status to be able to provide services, not placement, but services to a child in child welfare care custody? So it's an interesting conversation, but I think it probably will need more conversation to figure out kind of what the scope is we're looking at for that.
Yeah, because I think what I would advocate is that if we're going to be okay with sending our kids out of state to LLCs, we should probably try to figure out a way to have LLCs or to allow LLCs to be licensed in this state so we don't have to send our kids out of state and away from families and whatnot. So I think that if that's the conversation that we want to have, I think we should really, really consider using that same exemption that we would give to other states and apply it to Oregon. Because I would think that would or could potentially help with increasing the number of providers that we have in Oregon, and then overall, reduce the need to send our kids or youth out of state and, further away from family or close family, if the overall goal is reunification with family in particular.
Thanks, Alicia. Our governor's office friends have joined us. I'm gonna, I hope it's okay if we hear from Andrew first and then move to Rachel and Amy, and then we'll probably go to our break after that. Okay, Andrew Grover.
Okay, so I just want to be really clear on this because we're talking a lot about what type of corporation, and I think that's important. But as it stands right now, in order to place a child in another state, they have to be licensed as a child caring agency in Oregon and be a certain kind of corporation. I think that's correct. And what we're talking about changing here is just the corporation side. They'll still have to be licensed as a child caring agency in Oregon, right? Is that accurate? Because that seems like an important part of this.
I think we're getting to other parts of the bill. So I again want to hearken us to, there's other portions of this bill that all knit together.
Okay, but can I get
we're way down a bunny trail that when we're talking about out-of-state placements, this is one piece of a larger conversation.
Okay.
And so I want to put a pause. I want to press pause on this, move to our friends in the governor's office, and then again when we reconvene and go back, this thing is in totality.
Yeah.
And we cannot keep going down the bunny trail of particular sections, because at the end it all knits together. We have an entire conversation about out-of-state placements coming. So
Okay,
can we hold that for then?
That's a real question. So I wasn't expecting a big
Yeah, let's hold that for then.
All right. I guess Amy and Rachel, which of you would like to go first?
I can start us off, and then Rachel's going to speak more to the governor's recommended budget as is specific to child and family services. So hi, SOCAC. Good to see all of you again. So boy, I've been in here for about a month, so and I'm gonna keep saying that as long as I can to keep buying grace from you all. Eventually, it'll be like 12 years, and that line won't work anymore. But anyway, so the governor has made a pretty significant investment in. Thank you, Joylene. Behavioral health with her recommended budget. She's looking at a $90,000, sorry, 90,000. I'm not at CBH, I'm at the state. $90 million investment in capacity for adult residential programs to include SUD residential and withdrawal management and mental health services. And some of that will invariably include SUD residential for moms and kids. She's looking at a $10 million residential capacity for youth, SUD and mental health. She's also doing a investment in workforce because obviously you can't stand up new. Thank you, Joylene. Can you just follow me around throughout the day? That'd be like super helpful. Workforce investment, because you can't stand up new programs unless you have the workforce to do that. And so there's about $50 million that's going to go into workforce. A lot of that being connected to training, education, and then things like tuition assistance and loan forgiveness. And that's obviously designated for both individuals working with adults and youth and family. And then there's a whole set of funding that's really focused on how to address the current fentanyl crisis with deflection and jail-based MOUD, and which MOUD is medication-assisted treatment. So with that, I will hand over the youth-specific services to Rachel.
Hi, everyone. Rachel Kearns Henry, she, her here. It's nice to see all of you. I want to acknowledge that many times I do not come directly to the SOCAC meetings. I meet with many of you separately offline. I meet with Anna regularly, almost weekly. And I just have such respect and appreciation for all the work that you do. And I'm just thrilled that we have Amy with us now as part of the governor's office as our behavioral health director, with her experience working directly with all of you and really understanding the issues, especially across systems and work for kids and families. So it's a pleasure to have Amy and to be here with all of you directly. So I want to approach, just give some updates on the overall investments and speak to some of the specifics. So overall context, just to acknowledge that we are very happy that we are in the place that we are in terms of a budget environment. Just having these discussions where I know I've been meeting with many of you over the past months, we were very much in a framework of looking at a budget environment where just to be able to keep the doors open with the caseloads that we had growth, I just want to acknowledge the Department of Human Services needs an additional $1.3 billion just to be able to cover and provide services for who we cover for our current service level budget. So we were approaching our budget really from that mindset of we need to make sure that we can maintain current service level to maintain the cost to be able to operate our programs and find $1.3 billion in general funds to keep going. So in that frame, I think you all know the governor said, I need a 1% list from agencies only. I'm not asking for a wish list. I'm asking for practical, realistic solutions. And I'm also asking for reductions, looking at a 10% reduction list. We also were mindful when we were coming into this, knowing that the governor wanted to focus on behavioral health workforce, and we were mindful of the work that we've been doing with child welfare, with our Wyatt litigation, Where do we need to grow with April's vision for transformation? What is the special master report, which you've all been talking about, stating we need to go? How, when we read the SOCAC reports, is the SOCAC going into a strategic planning process over the next year, thinking about the system? How do we think about these investments that align with the work that you're doing and to help support these goals? That's the needle that we were threading as we thought of these investments. So in the $25 million that's going directly to OHA, $10 million is going to residential treatment capacity. As Amy mentioned, our emphasis here, based on your advice and looking at advice from the ADPC and based on the need, the demand that we have, is we'd like to prioritize those investments to focus on co-occurring diagnoses for SUD, period. Second, community behavioral health, $7 million investment. As we looked at your report and your legislative report and recommendations, and we looked at the work ahead, we were hesitant to say, let's go and do new community behavioral health models. We heard you. We said, well, let's invest in what we know we need to focus on, the intensive in-home behavioral health treatment model. But what it seems like we need to do is we need to help address rule changes, and OHA is working on those items. We also needed to help expand and support provider adoption, do provider recruitment, have some recruitment to grow that model, and potentially test out that model to be able to do SUD expansion with IIBHT. That's what we're proposing as we think about that $7 million community behavioral health investment. Those were our two main categories on the OHA side when we thought about how do we address some of the higher acuity needs in both in residential and in a community setting. We then realized, as we all knew, we need to focus on prevention. We really were thinking about the demand for prevention is great. And we were doing what we could with a small amount of dollars. We had $7 million that we were looking at for prevention resources. As we're thinking about that strategy, we're focusing on our schools primarily. We're looking at school-based health centers and how do we help to expand those school-based mental health grants to ensure that we can provide additional access to behavioral health supports, SUD screenings within school settings to make sure that we can serve kids. We also have some dollars set aside to do prevention education within schools that are within that framework. And there's $1 million for culturally specific suicide prevention, which Ebony and her team advocated for within OHA to make sure that we can continue to address the disparities that we have in our state when we look at suicide prevention. And that is the culmination of the $25 million on the behavioral health use side on the OHA side of the house. Then we go to the DHS side because we really think about this. Again, this is the systems of care. What's the system? Where do we need to have additional investments over on DHS for kids and families? We included a $10 million level of investment to fund innovative treatment models within DHS. The thought process here is that we have co-occurring that's going to happen at OHA, and we need to help think about what is it that we need statewide access. How is it that when we think about what we need to do for small 1 to 2 bedroom homes, other types of models, how do we have funding to be able to test those innovations? We also left this funding pool flexible because, as you know, we have a neutral coming in, providing advice to us on maybe some other ideas that we need to think about. We wanted to make sure that if we needed to pilot any other types of models, that we had that pool available to do so over the next biennium. And that's that first $10 million of my total on DHS is $23.6 million that we had for investments. The additional categories we had in new investments at DHS included making sure that we had ongoing funds with the federal funding going away for the Family First Prevention Services Act. We need to ensure that we maintain funding and investments with general fund dollars for prevention funds for substance use and mental health prevention. We also heard from our Sarah Fox and the treatment services team that the focus program for parent coaching has been going really well. And maybe that's an example of a model that we should expand to additional counties. So we did fund additional staff to be able to expand that model to additional counties as well. We also know that improving how we do our work day to day and thinking about contract oversight was a critical investment that we felt was appropriate to make given some of our discussions over the past year. We did advance an initiative, 1.9 million to do centralized contract administration across the child welfare portfolio and all of the districts. I think this will align nicely with the work that April, Director Flint Gerner is leading in child welfare to help ensure that we have integrity and oversight across all of our districts as well. And then finally, in terms of, I know some of the work that you're all doing, we were able to advance a $4 million investment for the independent living program to ensure, as we think about foster care youth and transitioning into adulthood, we know that we've had discussions on the need for some additional rates and investments to ensure that we can continue to help with that transition. We also funded 3 positions within the child welfare team to help to ensure that those kids exiting foster care who have not accessed potential SSI benefits so that they could have federal funds are able to do so. That was an innovation that I believe SOCAC also mentioned at some time in the last year or so. That was included in our investment package for DHS as well. That is the new funding for DHS. I also want to highlight, as I mentioned, maintaining the current service level budget for DHS was tremendous and part of what we needed to do. Why? Well, as you know, treatment foster care is an initiative that we started over the last 2 years. The DHS CSL budget continues that investment for treatment foster care of a $7.6 million investment going forward. We also maintain the dollars that we have funded to ensure that we have placement capacity for capacity-based payments within the DHS model. That funding remains within the DHS budget and continues for those capacity-based payments for DHS. We also last biennium, there was a rate increase for resource parents. There was some question, is it a one-time, is it an ongoing? Our executive team's budget assumes that the resource parent rates are ongoing, and we built in that rate increase into this current service level budget to make sure that we continue to have resource parent supports for being able to serve our kids in child welfare. And the behavioral rehab services budget within the DHS CSL also has built-in rate assumptions as well. Speaking of behavioral rehab services, and I mentioned CSL budgets, I want to go back to OHA for one moment and just acknowledge that many of in this room have identified we needed to ensure that we had some investments to be able to expand the behavior rehab services program, not just to be able to access that program if you enter through Oregon Youth Authority or through Oregon Department of Human Services, but through OHP. And there is money that is built into the OHA budget to ensure that coming into federal compliance for how we should operate that behavior rehab program is part of that funding pool. And I just want to acknowledge that as well. Finally, in terms of the youth kind of system portfolio, I want to recognize that we were able to maintain $20 million for the youth homelessness investment that we invested in 23-25. We were able to maintain that $19.7 million investment going into 25-27 to help focus on youth experiencing homelessness as well. And I believe I just got through the big kind of bucket list of all of the different policies that we feel really great that we were able to advance through much of your advocacy and support. Before I pivot to kind of our next part of this discussion, where I want to talk about some of the policy changes that we think that this budget is teeing up, I want to pause and make sure that in my very rapid way of talking, I answer any questions or any follow-ups or any feedback that we want to make sure that we bring back from the SOCAC to the governor and our team.
Questions or comments for Rachel Kearns-Henry and all the budget information she just shared with us rapidly?
Well, and sorry, this is Amy Baker. Feel free to speak, but I, having worked in the system for a long time, I do have concerns about some of those investments and whether or not we're going to have willing partners from the provider community who are going to be willing to develop capacity given the current regulatory environment that we're in right now. And obviously, my interest is in ensuring that that if we're going to invest in these programs, that we're able to stand up programs that are effective and can actually do the work in the way that they're intended to do.
Yeah, thanks, Amy. I think that's why we're very hopeful and excited that you are having the discussions that you are in talking about potential policy and legislative concepts that need to be advanced. Specifically, you know, as Amy noted, when we were having some of these discussions, the governor said directly to me, she said to Anna, our director, if we're going to make these investments, as Amy said, how do we make sure that they're meaningful and that we're going to have providers who are going to be able to take these investments and move them into our system? And so as such, the governor asked, I would like to understand, are there recommendations that the SOCAC has? And she meant this process that we have created for this reason, where providers, youth and family voice are working through and have made recommendations over the years. Are there any targeted policy or legislative concepts that must be advanced this session to ensure that those investments that I just articulated are meaningful? And that's the discussion that I know you're about to engage in. We are not here to say, these are all of the changes or this technical change. We're not here to get into those technical weeds. In my mind, and as the governor has noted, the SOCAC is the advisory body. And if the SOCAC advises, she wants to lean in and listen to that recommendation. And so we are deferring to you to help us understand what are some of those policy and legislative concepts to do, just as Amy noted, making sure that we can make these investments meaningful. When I have that 10 million pot at DHS for temporary lodging, just want to acknowledge, I think right now we've had a request for proposal out for, I don't know, 6 months to try to find some providers to do that work. And we haven't been successful yet. But we're putting the money in there because we know we need to build it. And so we need to identify how are we going to do that? And are there changes that we need to make in that policy and legislative landscape? And I know, just wanted to acknowledge that those are hard discussions, and acknowledge that what we all care about at the end of the day, confirming, is child safety is paramount. None of this is at the expense of child safety. Obviously, making sure that we have that we are caring for our kids is it is guiding us, and making sure that we have providers who are able to help work in that environment and serve our kids and families is critical. Anything else from your seat, Amy, before we turn the floor back over to Anna?
Okay, well, thank you so much, Governor's Office. I think what we're going to do now, Council, is marinate on those words, what we just learned from the Governor's Office, and take a break, which we had scheduled for earlier. I didn't want to go on break right when we thought the Governor's Office was going to be joining us. Then we'll come back and pick up where we left off, and we're going to try and pick up the pace a little bit on this conversation. Not that we don't need to get into the weeds, but we are going to run out of time today. This is all the rest of the topic until 4:30, but I want to make sure we get to each point along the way. There will be opportunities potentially to continue this conversation at legislative committee and future council meetings as well. So today will not be the last bite at the apple. My hope is that this is the beginning of an important and long conversation. So I'm going to share our little break slide. We will return from break at 2:30. I apologize, you're only getting 8 minutes of break today. And we'll call you all back into the room right before our break is finished. Thanks, everyone. Allison, Andrew, Annette, Emily. Adam's back again. Poor guy has to keep calling us every time his phone drops him from service. All right, it is 2:30. I'm going to skip back to the slide we left off on. We are going to go through a little bit more quickly so we can make sure we cover all the topics that need to be covered. Some of the questions that are coming up are addressed in later sections of the report. So my hope is that as we sort of walk through this, we can get into a deeper dialogue towards the end. We have some time set aside for questions, comments, and recommended amendments that will carry into our legislative committee meeting tomorrow if we vote to carry this bill as the council. Adam was going to speak to child and care abuse statutes. I don't know, Adam, if you have good coverage and you can speak to that from the road.
That's actually Adam Peterson.
Oh, Adam Peterson, have at it, sir.
I am pinch hitting for my friend and colleague and fellow Adam, Adam Rodkowski. So I will start out by saying exactly that, in that I am going to present what Adam has worked very hard with the rest of the Legislative Council folks to talk about. So anybody who has more knowledge or additional knowledge than me, feel free to hop in. I'm going to kind of go through the things that I know are major points about the child and care abuse statutes. And that in 2017, the Senate Bill 243 expanded the child abuse definitions, and it included ODHS child welfare certified homes and those that were in the Oregon Developmental Disability Services. One of the things that it did not do was expand to OYA, or for folks who had who were involved in the juvenile justice system. And that it clarified that children living in the child caring agencies are not children in care if cared for by a parent. Excuse me. And then exempted all of the child caring agencies that were without staff or volunteers, and excluded age appropriate discipline from the definition of involuntary seclusion. This did leave some remaining gaps. And go ahead and just go to the next screen, Anna, unless Robin or Anna, is there more that you'd want me to say here? Okay, cool. Next up, please. As I'd mentioned, that there were the Oregon Youth Authority, thank you for putting that in, Joylene, was not previously included in this, and that the Senate Bill 243 also made it so that it did not apply to folks who were, sorry, hold on. It did not apply the definitions to employees, contractors, and volunteers of child caring agencies, residential facilities, foster parents, and individuals running foster homes. And in our current, in what we are proposing in our legislative concept, is that it would exclusively work with employees, contractors, and volunteers of child caring agencies, residential facilities, and individuals with developmental disabilities, foster parents, and individuals running foster homes. It would improve consistency by including all Oregon Youth Authority folks under the child and care and aligning the regulations and definitions. And it would also clarify the legislative intent, including that parents and relatives and community members are not considered in this legislative concept. Are there questions, concerns, or things that folks would want to talk through about this part? Or Michelle, go ahead.
Yeah, no, there were just a couple of points on here that maybe the AI didn't catch quite right. So just to make it clear, really there's just two kind of key things the proposal will do. So it does codify what was the legislative intent, that the 418 child and care, child abuse definitions only apply to specific folks, individuals. And so it codifies that in statute of making it very clear that those 418 child abuse definitions don't apply to everybody in the world or in Oregon. And then does expand the child and care definition to just include youth and OYA certified foster care, so that all foster care, regardless of where youth is, the same definitions, quarterly reports, kind kind of all the regulations, very similar regulations apply consistently.
Great. Thanks for that, Michelle. Appreciate it.
Robin?
I think the next slide is the impact. Sorry about that. Tribal youth served by OA foster homes would have added protections under this tweak to the bill. And these amendments actually align the practices in screening and investigation across the service settings. We're not expecting a huge impact to workload, but we are expecting that this is going to be more consistent, as Michelle and Adam both stated. Do we have any questions about this section in particular before we move on? And thank you, Adam, for doing a nice job. Let's go to the next slide, because I believe that the next section is Andrew Grover. Go for it.
Yeah, so I'm kind of stepping into this one in large part because it's a lot of what is involved here is related to the federal Family First legislation, which I've made a study of personally. Our organization is heavily invested in. And so as you can see there, 2018, Family First passes. And it basically, did a couple of really fundamental things. The first one and the biggest opportunity in Family First for more intensive community-based family, in-home supports was the prevention side of it. That first bullet, reforming child welfare financing to help prevent kids from entering foster care. There's a certain pool of money that prior to that could only be used if the child was in foster care. With Family First, it basically says you can take that same money and help invest in families to prevent kids from going into foster care. So that's the real opportunity. But the other big piece of this legislation was it limited funding to residential programs who they would have to be what's called a qualified residential treatment program in order to get federal funding. So a qualified residential treatment program has to do a couple of really important things in order to be kind of certified as that. They have to have 24-hour nursing. They have to be accredited by a national accrediting body. They have to provide 6 months worth of services to children after they've left their programs. And so not all residential programs are kind of organized around that. And so there are a handful of non-qualified residential treatment programs in Oregon. If you look on the list, I think it's mostly non-BRS shelter type programs. So then in 2019 comes along and Oregon passes a bill that aligns Oregon's use of QRTPs, that Qualified Residential Treatment Program, to Family First, and then limited congregate care placements to only QRTPs with just a few exceptions. But then it also went on to put time restrictions on placements for youth in non-QRTP settings. So if a youth is in a non-BRS shelter, they could only be there for 60 days, right, consecutively, or 90 days cumulatively in any 12-month period. So there's these time limits on that. It's important to note here that Family First also has some time limits on how long a youth can be in a non-QRTP setting, but that's just for the funding. It doesn't say you can't do it. It just says you can't get federal money if you do it. So that's sort of like if you go and brush up on your Family First rules, you're going to see that there's a federal rule that says you can't be in there more than 14 days. But they're just talking about you can't ask the federal government for money after 14 days. So that's an important thing. So let's see, what else did I miss here? Okay, I think that probably kind of generally captures it. There's time limits on non-QRTP settings. That's one of the biggest things here. So there are some barriers that have come to light in getting youth the right treatment. And specifically, they're clinically and culturally appropriate placements for youth. that may not have that QRTP status. So basically, this legislative concept, ultimately a bill, will allow placement into a non-CCA setting, still licensed as a CCA. Non-CCA licensed setting. Oh yeah, when the Medicaid entity approves it. So a CCO basically says that's medically necessary. So we need the youth to stay there. And presumably these are some of the outcomes: be more child-centered and avoid temporary lodging. So making those exceptions for clinical and culturally appropriate reasons. So then going past that, I already talked about the 60 consecutive days and 90 cumulative days. That's in the Oregon statute. It's not in the federal statute. You just cannot go past that. And obviously the intent there was to move youth more quickly into permanent placements. But what's happened is that, a youth might be in a shelter care program and they feel safe and supported and they're being observed and things are going okay, but the clock's ticking and another placement isn't found. So they hit that 60 days and they have to be moved because of that. Kids can, bouncing around from temporary placement to temporary placement. So proposed solution to that is to increase the length of time for 30 additional consecutive days. So now it's 90 days instead of 60. And 30 additional cumulative days. So now it's 120 days instead of 90. And obviously those extensions have to be in the best interest of, that child right there. And then also the last one here is to enable the youth to remain in a non-QRTP placement if they want to, right? If they're in a place where they feel safe, supported, stable, they can say, I want to stay here. As opposed to being removed from that placement because the clock expired. In some cases put in temporary lodging. So that's the other solution. I think those are my slides.
Yep. Thanks, Andrew. And Robin pointed out in the chat, there's a good story, and I don't know if the link is in the policy brief, but there's also a link to a video of a young person telling their story about wanting to stay in a non-QRTP placement because that was where they were thriving and what they had to do to try to maintain stability as they were trying to graduate from high school in the location where they had been for some time. Allison Stark?
Yeah, I just and maybe you said this, Andrew, so I apologize if I just missed it. So can you give me an example of what a non-QRTP placement would be? Like, is that a facility, or is like how is that like what is it? What's the regulatory environment?
I can answer this if that's helpful, Andrew.
Yeah, please do, Michelle.
I don't see them. So they are licensed CCAs, and an example could be a homeless and runaway youth shelter. So I think a couple of the examples, there's Hearts with a Mission, and there is an example from Youth Tides, which is on the coast, where we have heard from examples of youth who have thrived in those settings, but have hit those deadlines and had the complication of placement disruption. I just want to give a little bit of context to that as well. On any given day, there's only about 12 children in any of these settings in child welfare custody, and their age ranges are about 15 and a half to 17 years old. I just lost my train of thought. Well, did you have the other question, Allison?
I don't know, but I think that this is one of the areas that I struggle with just a little bit, because my concern would be that when we see, we do need to provide, what my concern would be is that when they become adults and they're in these type of environments, that this is a straight line potentially to homelessness, frankly, because these are not homes. These are temporary settings. So while I appreciate there's a desire to not want to disrupt a placement that is maybe working for a youth, I also don't know if this is the best environment for a positive transition into adulthood. And I think we owe these youth better than that. And so I'm like ever so slightly uncomfortable with this because it feels like in an absence of good placement options, maybe this is better than temp lodging, but even then, the reality is that we need to create more residential environments. And you know, my hobby horse, which comes up every time I start talking about this, is that we don't need more facilities. We need more residential houses, kind of like in the IDD system for these youth that are really complex. We need to create home-like environments, whether that's with, you know, 24-hour staff or whether that's with shifts. I don't know how it works or how we want to structure it, but I don't really want to see more facilities. And I also don't want to see, I guess, kids being placed in shelters long term.
Yeah, I think this is one point that I think we end up having a talking point at the end, but I'll bring it up here that might be helpful. So for any exceptions in these like in-state or out-of-state placements, the expectation and a requirement in the legislative concept is for those to be whenever the agency approves an exception. So let's say it's approved an exception for a child to be receiving the, you know, culturally appropriate or and clinically indicated treatment, or if it is one of these non-QRTP placements, the expectation and the requirement in the stat and the bill would be that there is a quarterly report to the System of Care Advisory Council to summarize the narrative of kind of the circumstances that resulted in that, because there needs to be an element of system analysis and accountability to the agency, right? We don't want this to be overused. We don't want children placed out of state in great numbers, but there are very unique situations, and I think that there needs to be a system look at kind of what does need to be created. What trends do we see that we're having to make these exceptions for, to better know what capacity needs are needed in Oregon or what is missing in Oregon, or part of the environment that we're having to make exceptions. So that's an intentional piece of this, with a report back in 2027 to see like how is this working and kind of what have we identified.
So just to clarify, so when it says up to 30 consecutive and 30 cumulative days within a 12-month period, that means, how does that play with the current timeline, the 60 or 90?
Current timeline is 60 consecutive 60 consecutive days or 90 accumulative days. So like Andrew said, at the 61-day mark, children are having to leave that setting for a night, having to go into some other kind of temporary placement, hotel, whatever, and then they can go back to the shelter for another 30 days. What I understand from the data is the vast majority, and from providers, the vast majority of youth just need a little extra time. So they felt like not like this could easily be addressed where kids don't have to have that one night disruption, or a longer disruption, if they go past the 90 or the consecutive or accumulative day, sorry. And again, that would be a required report from the agency to the System of Care Advisory Council whenever that exception is made.
Thank you.
I think there's one more slide in this section, Anna. Yeah, this basically, again, looking at the tribal impact, any child welfare eligible youth being served by ODHS would experience that added flexibility as well and can be more likely placed in settings that are medically and culturally appropriate. It also allows for added flexibility with the self-advocacy based extensions that we were discussing. Any other questions about this section before we move to the next section? And we are going to talk about the reporting requirements in this. Reporting requirements will come to the SOCAC, and the SOCAC does report regularly and routinely to the legislature. Let's move to the next sections. Jill Archer.
Thanks, Robin. I want to give the same caveat that Adam did. I was not involved in the creation of this, but jumping in and happy to help support making sure that everyone understands what's here, and have, you know, a history of remembering what it was like before some of these rules went into place. So this is really the section around the out-of-state placements, and kind of the current state is that ODHS cannot place children out of state unless there are very specific circumstances. And I think that was covered earlier around the type of license that they need to have outside of Oregon. And all in-state resources must be exhausted. And then currently ODHS has to investigate any suspected child abuse in those out-of-state placements. And youth in ODHS are not allowed to be placed in agencies that serve primarily youth in the justice population, locally or in other states. So we can go to the next slide. So current state, fewer than 6% of our 4,500 youth in foster care require a specialized service. Many of those may not exist in Oregon. Some of that is economy of scale, like we may just not have enough youth in need of a specific specialty type of care on any given day, or it may be that we just don't have any current availability in the resources we do have. And the Ombuds Office recognizes the need for that rare out-of-state placement for medically necessary treatment. So some of the proposed solutions are allowing some exceptions that we'll talk about a little more when it's medically necessary and appropriate. And that would put youth in ODHS custody on par with youth who are accessing services through other means like the Oregon Health Plan or other insurance, and give more flexibility for those who are in the Indian Child Welfare Act program in out-of-state placements. Next slide. So one problem is around those youth that are placed with relatives under the Interstate Compact. And if they do require placement in a residential treatment program, most likely because of the current rules, they would have to come back to Oregon if there was something available, which A, there may not be something available, but B, that's really disruptive to have to leave the family that they're trying to maintain a relationship with to come back to Oregon. So one solution here is just allowing exceptions for treatment under the ICPC placement when it's medically necessary so that the youth can remain in their current geographic area with their family and community. And then the other issue is around youth under the ICWA placement. So just one example is, you know, and this, we'll get into this a little bit more with just geography in general, but a lot of times there's an appropriate placement that's closer geographically and more appropriate, but doesn't fall under the current rules. And so this would allow, again, an exception for youth in ICWA to be able to go to a program that is recommended or supported by their tribe that may not qualify under the current rules. So there would be an exception for that. So in that example, that youth might have been living in Oregon, but be part of a California tribe and go to a placement in California. And then just, again, the geographic. So a lot of Oregon is actually closer to resources in other states than it is to resources in Oregon. And so Right now, youth have to essentially go to resources in Oregon. So if you're living in, the eastern or southern part of Oregon and you have to come to the metro region versus going somewhere that's maybe 30 miles across the border to Idaho or California, that's much more disruptive. And you could be staying close to your family and they could be visiting you, et cetera. So this would propose exceptions to the current regulations so that youth in those rural areas could access treatment in neighboring states that are medically appropriate and closer to their community. And then this gets back to the licensing issue, but in order to work with out-of-state adoption and foster care agencies, we currently require them to be licensed as child caring agencies in Oregon, and that's not always the case. And that is inhibiting potentially opportunities for youth to be placed with adoptive or foster families that could be, their permanent caregivers. So this is would amend the out-of-state licensure requirements so that they wouldn't need to be a certified child caring agency in Oregon, but would have to be in good standing with whatever the current state license is. And again, this is one of those reporting areas where it would come, any exceptions made would come to this council quarterly. Next.
I think that's our last slide in this section.
Great.
Correct? Next slide. Yeah, this brings Oregon into compliance with the Oregon Indian Child Welfare and Indian Child Welfare Act placement preferences for institutions approved by tribal communities or run by an Indian organization. Oregon used to have treatment facilities specific for tribal youth. We don't anymore. And those facilities now are often out of state, and they're very important from a cultural standpoint and for helping kids get the care they need. It also allows not only Indian Child Welfare Act eligible kids to access, like Jill was talking about, when you're in Baker City, I-5 corridor is farther away than Boise. And we really need to be thoughtful about where Oregon, being such a large state, we maybe have a very small population, but we have a very large land mass that often is easier for folks to access facilities and care to the adjacent states. Do we have any questions about this section that we want to talk about?
I had just asked a question in the chat about ODE because I recently met someone whose child is out of state at a school, and I was surprised because I didn't know that we did that. And so I guess I was just asking if is this really only impacting DHS versus has this impact? I mean, I guess how does that work with ODE? And maybe it's a digression and unnecessary, but maybe somebody could just raise their hand and I could reach out after and get my question answered.
Allison, my understanding, and I could be wrong about this, is that this ban is only for kids in child welfare custody. So kids who are on Medicaid, but not in child welfare custody can go to medically appropriate placements out of state, as well as kids whose parents are able to pay for private or have private insurance. So it's just the kids who are in child welfare custody who have this specific limitation around access to those facilities.
Great, thank you.
Ebony Clark.
Hello, can everyone hear me okay? Okay, awesome. I was just, just reflecting on opportunity to be able to have youth access services closer to their community, even if it's across state line. I think that that's also another example of geographic equity. So just in the spirit of equity and thinking about, a broader definition, we have to think about, what are those strategies that can be put in place to achieve some of those needs from a geographic, thinking about rural, remote perspective when we think about the challenges, the ongoing challenges and barriers that those communities face. And so that's where my mind went. So
Thanks, Ebony. Anyone else before we move to the next topic? Michelle.
All right. So Restraint and seclusion. I'm just gonna dive in. If you can keep going, I'm not necessarily gonna get into the whole background, if that's okay. What I would most likely want to say is there has been legislation passed around defining restraint and seclusion. And what we currently have, and I'll just jump into the problem if that's okay, um, is very complicated definitions. So I'm going to blend this section with the school section as well. So currently, the statute has is very complicated. There's a definition that apply like a definition scheme that applies to child care agencies, foster care, and disability IDD, sorry, intellectual and developmental disability programs like residential facilities, group homes, and foster homes. Um, what I could tell you is, and I would ask anybody in this room if you would know that there are between 16 and 32 different decision points about whether an action or inaction by a staff is an allegation of child abuse. And that is 13 different decision points for schools. And I would bet that the vast majority of you are mandatory reporters, and the vast majority of you probably couldn't tell me those 16, 13, or 32 different decision points. And that's really where we've come and we've heard from community that this is a problem. It is too complicated to understand what is an allegation of child abuse when it involves restraint. And so really working off of the System of Care Advisory Council Safety Work Group, which recommended establishing a simple definition of wrongful restraint and wrongful seclusion that could be applied equally across settings. We came up with a proposal. Do you have the graphic on here of the kind of the, I think, yes.
Yeah.
So this is an example, phase 1, 2, and the skip SAPE only. This is an example of the child caring agency DD program decision tree that Otis screeners are having to go through right now whenever there's an allegation about the potential wrongful use of a restraint. When we convened a group of folks from schools, OYA, DD programs, CCAs, Oregon Youth Authority, hospitals, trying to think of who else was in the room. Really, we came up with some key elements that there was common agreement on would be considered an allegation of child abuse, that they would be concerned that needs to be investigated as child abuse. What this doesn't do, I will make that very clear, is that I guess this detangles regulation and what is an allegation of child abuse. This does not erase the regulatory or what is prohibited, but it defines kind of what action would be taken by whom in the state, depending on what's happening. And so if it meets one of these now, like 4 criteria for an allegation of child abuse, it will be assigned for a child abuse investigation. If it is a violation of one of the many prohibited types of restraints or one of the required actions, that would be a licensing action unless there is overlap, which there definitely could be. And then both could be actions taken. But essentially, this is trying to get common language, common understanding for youth, for their families, for the workforce, for mandatory reporters to understand when we say something is an allegation of child abuse as wrongful restraint, what those key elements are, and that you don't necessarily need an entire decision-making process map to understand it.
Kyle, you want to pick up in here on some of the other impacts, and then we'll stop for discussion here in a few slides.
Yeah, thanks, Robin. Yeah,
Can you forward a slide? There you go.
Yeah, I was asked to present the information here on this slide. I think because of my role over the last 13 years of working in our pediatric emergency department here at Dornbecker Children's Hospital while directing our child psychiatry consultation liaison service. And over that time, we've assessed hundreds and hundreds of kids that have presented to our emergency department in psychiatric crisis. And we have noticed changes over time, which I think may be related to unintended consequences from the present statute. So I'll go ahead and read here. Staff fear being investigated or found liable for child abuse due to technical violations. These are staff in child caring agencies, as I understand it. Concerns about having substantiated allegations on their records impacting future employment. Upward trends and denials and unplanned discharges from DRS and psychiatric residential treatment facility programs, and unplanned discharges lead to urgent placement needs, sometimes causing unnecessary hospital stays. What I've seen and our team has seen is that kids, particularly presenting with aggressive behavior to our emergency department, we do assessments and make a level of care recommendation, which often is to subacute level of care. That's where we most likely refer patients other than to acute psychiatric units. And that over time, we've seen the subacute units be less open, less comfortable accepting kids with aggressive behaviors, I think, because of their fear of not being able to safely manage them and being potentially investigated for child abuse if restraint or seclusion is needed. And so that has impacted, I think, in that regulatory environment, it's impacted staffing, which the rapid turnover of staff, which then impacts one's agency's ability to safely manage kids with aggression. And we've just seen when we make referrals, those units often say we can't manage a patient with these complex needs. At the same time that the acute psychiatric units, we have two in the state, one at Unity and one at Providence, will assess the referral and say the patient isn't acute enough to need that level of care. Or they potentially have concerns that if a child with aggression is referred to one of their units, that they may have trouble discharging the patient, especially if lower levels of care, such as subacute units or residential care, is not able to take them. So that's in my opinion, the statutes as they stand now, although incredibly well-meaning, have really impacted the flow of patients, particularly with complex needs such as aggressive behavior, through the system and accessing certain levels of care within the system. So the proposed solution: amend wrongful restraint and seclusion definitions to reduce workforce fears. Violations will no longer automatically trigger child abuse allegations, but can be addressed through licensing and certification actions. Maintain current regulations on procedures, record keeping, notifications, and training standards to protect child safety. Expected to strengthen workforce stability, enhance placement and treatment capacity, and improve care quality for at-risk youth. And encourages CCAs to retain children with aggressive behaviors along with reducing unplanned discharges and improving quality of care. I think Michelle's going to do this one.
Yep.
I didn't know if we wanted to pause or if we should just keep running through, Robin.
Keep going for the
Okay,
next.
thanks.
Why don't you take the next two slides, Michelle? I think you're.
Okay.
Yeah.
So reduced use of video recording. So with the passage of Senate Bill 710, which implemented a lot of the protections and regulations around restraint and seclusion, there was a mandate to share videos of restraint and seclusion um, with certain folks involved in the child's life. And some of the issues that came up with some of that legislation ultimately resulted in some providers stop recording their video. Is there reports that it was high costs for storage and the technology to blur faces to maintain confidentiality, concerns about HIPAA violations, and increased liability of public disclosure of the videos. What we do know is that the reduced video recording has resulted in fewer impartial kind of evidence sources for Otis investigations, and likely is added to the increased investigation timelines because we don't have easy access to that, what I think is the best unbiased witness in the room, which can be video. We did a partial solution in collaboration with Senator Gelser-Bluen in 2023 that shifted the responsibility to Otis to ODHS for redacting videos and managing the requests from a child attorney, court-appointed advocate, parent, or guardian. But that still didn't go far enough to address the child's rights and liability concerns that still exist, and has not resulted in any additional providers turning back on that recording feature. So this legislative concept has the proposal, instead of actually providing the attorney, court-appointed special advocate, parent or guardian with a copy of the video, it would be an opportunity to review that video. And it would require the consent of a young person over the age of 14, similar to that of other behavioral health minor consent statutes, and would not necessarily need that for anyone under the age of 14, but would align with a legal guardian providing that consent, very similar to our current consent statutes. So that's reduced. There we go. Limited models of crisis intervention. This was another part of Senate Bill 710 to limit the amount of crisis intervention models to 2 or 3 for all child caring agencies. In total, when Otis licensing was looking at the types of models that could be considered, there were 11 that were submitted for consideration, and 3 were ultimately selected. Those 3 models are the Oregon Intervention System, which is used by the Office of Developmental Disability Service Providers, Crisis Prevention Institute, which is often referred to as CPI, and the MANT system. And we transitioned all CCAs to those new models with some partial support from the American Rescue Plan Act funds. And since that time, there has been continued requests from the provider community to have a greater number, because this is a barrier for new providers considering operating in Oregon when they've already invested a lot of time and resources on a specific model, when they've considered coming to Oregon. And this has also been a barrier in considering licensing out-of-state providers. When they are using a nationally recognized model that would be considered, meeting the criteria of the existing models we have in Oregon today. So really the solution is to double that and offer the statute to not just limit to 2 or 3, but to open that up to 6 approved models. And one of the factors we've already gotten feedback on is to have a youth and family committee provide some guidance to ODHS on selecting those models. And so we're definitely looking at that amendment into the process, but just want to increase some of those models so that we have a little bit of diversity and flexibility for those who want to be serving our kids.
Thank you. And Kyle, did you have anything you wanted to add? I realized I had asked you to prep for that section and then I dropped it out. Sorry about that, Kyle.
Oh, your audio is completely cut out, Kyle. You're not showing as being muted, but we can't hear you. Try again. Yeah.
Hello?
Gotcha this time.
Okay, great. Just that the evidence base for interventions changes with time and evolves and improves. And that the interventions that are decided to be best for a state at any one point in time, may not be the same years down the road, and just because of the way science works and quality improvement works. So it'd be nice to be able to evaluate and to add additional intervention models.
Thanks, Kyle. And then there's a comment in the chat from Carissa about the cost of facilities getting certified for these different intervention models, and wondering if there would be consideration for cost in terms of adoption of the model for different types of providers. So that might be something, Michelle, just to kind of include in terms of if we decide that we're moving forward with this, that's one of the considerations, either that's considered by Otis or that's considered by the Youth and Family Panel that would make recommendations that we just discussed. Allison?
Yeah, something that I had raised about this section is that essentially, while there is supposedly a choice between the various providers, really on the ODDS side, we can only use OIS because there is no path forward that has been created to use anything else. I would argue that OIS is probably, while the most affordable, is probably the least effective, in my opinion, at doing what we need it to do. And so one of the suggestions I would like to see potentially is a kind of a mandate that there really is choice and that we are able to actually use these other systems if we would prefer to use them, because right now it really feels like if you're in the IDD system, you're really having to use OIS. Secondarily, I do think cost is generally, a challenge overall, because there is, a fair amount of cost to the CPI or the MANT system that really probably should be addressed as well. So, Carissa, I agree with your question there. Thank you.
Thanks, Allison. And Robin responded in the chat that expanding the options to include DD providers, that they could choose the intervention model that works for their facility, is included in the proposed amendments that have kind of been passed forward. So good, that's good. And then I saw Alicia nodding during that. I also have been talking to some families who have youth in DD facilities now who are not fans of OIS, and it's pure behaviorism basis for engaging with young people. And so expanding to some different options was in response to concerns from parent advocates and actually a sibling advocate as well for a young person who's in a DD home. Alicia.
Yeah, thanks, Anna, and thank you. Oh gosh, Michelle?
Yeah.
Did I get that right? Okay. For highlighting that feedback. I really appreciate it because one of my soapboxes, I guess, that I like to stand on is I would really like for the state of Oregon to kind of expand a little bit more outside of the behaviorism area or arena of crisis interventions, particularly because especially when we're talking about like culturally responsive services and so on and so forth, right? So, and in particular, what Allison had mentioned, the sorry, particularly the OIS kind of framework, and that being used with individuals with IDD or experiencing IDD is probably one of the worst that I have personally experienced. So I appreciate this conversation and really just want to elevate um, uh, the my advocacy of creating a self advocate, meaning youth, and then family rep kind of task force or work group to inform the potential new frameworks or systems or models to be used.
I appreciate you highlighting that, Alicia. And I think one of the things, as we talk about the number of models, like 6 is what we put in to start the conversation. But I think there's willingness to have feedback on like what is the right number, or do we start doubling it and then see what kind of diversity of programs we get and kind of what the criteria is met. Um, but I'm not the subject matter expert on this piece. I think I just want to be transparent that like 6 isn't necessarily like a magic number. It is a best guess of the programs that our licensing team is aware of, that they know would already meet criteria that we are not currently allowing to be used in Oregon.
Michelle, and just sort of thinking my way down that little rabbit hole, we can have that conversation about is 6 the right answer or not. But I also think if we have that advocate panel, they could also make a recommendation in the future that 6 is or not isn't the right number, right? And that if we could come back and run another bill if we wanted to go to 8 or whatever that parent advocate and youth advocate panel had recommended.
I like that idea.
We wanted to pause at this point and go back because there's been a lot in this initial part of this section. The initial information that Michelle proposed, the workforce challenges Kyle addressed, the video and stuff like that. Take a breath and go, do people have questions in that section before we move on to the rest of the slides in this section? Or comments or things they wanted to discuss? I think we are almost there. Yes, Ebony.
Yeah, I mean, I think just for the sake of, clarity and being able to kind of think about, so I saw, the crisis intervention models, and my mind, I go to MRSS, I'm thinking about, behavioral health crisis. And so the question is, when we're talking about crisis intervention, my assumption and my lens is specific to some of, the mental health or psychiatric challenges and needs. But I just want to make sure that that's what it's focused on, or is it also more broadly in terms of just some of the challenges and needs specific to what youth might be experiencing in child welfare or temp lodging?
Got it, Ebony. So in this case, the crisis intervention model, and this is why terminology is so important. Crisis intervention model is the training that facilities use in their engagement with the clients to ideally prevent and then respond to behavior challenges that happen in the care setting. So it includes how do you engage with that young person? How do you identify and understand what their triggers are? How do you remove those triggers? But also what happens if that young person starts using aggressive behavior, if they start hurting themselves, if they start hurting other people. So it defines a whole structure, which the very sort of deep end of that structure is the restraint or seclusion intervention, but it should also include a number of preventive steps and strategies that happen to avoid restraint or seclusion as a last resort option.
Any other
not like MRSS, which is like a public health crisis intervention, but not a clinical one-on-one crisis intervention.
Any other comments before we move to, at least their consequences for providers not to use video recordings? Good question. Michelle, do you want to take that, or who's got the video recordings?
There are currently no consequences, or I would say incentives. Like neither exist in our system to either incentivize providers to use video recording, and there is no consequences for them to have turned them off or to not use them.
Okay, so now my follow-up question to that is then how do we Okay, so the reason for not I want to be clear on what this means. Okay.
Yeah.
So with this change, like what does this change actually mean? Does it just mean that they don't have to, like they're not required by law to use video recordings? Or are they just not required by law to hand over a copy whenever there is an allegation?
Yeah.
And if it's only step 2, or if it's only the second one, but they're still required to use video recording, how are the problems regarding cost and the
Mhm.
HIPAA violations, mitigated with this change in the law if they
Yeah.
still have to use video recordings?
Love the question. So we, in 2023, we took the cost piece off of providers. So the state now owns that cost. So that is resolved. Not so sorry to cause the confusion. The original statute caused that issue. We resolved that one. The HIPAA and the element of youth consent are still an issue in that, or maybe it's just the youth consent part that's an issue. No, I guess HIPAA, sorry to be thinking about this in the moment. So yes, HIPAA is an issue when we are handing over a copy of the video to an attorney, to a court-appointed special advocate, to a parent, to a guardian. The concern is they could broadcast that all over the internet, and that would be a violation of that child's HIPAA protected information that they were in a residential facility, potentially getting certain treatment, having a behavioral health crisis that required an intervention. The second piece to that we're trying to get at is it's a little bit different maybe if the youth has consented to that video being provided to these folks when they are over the age of 14, similar to the consent statutes that are in the behavioral health statutes. I think it's 109, or I'm not going to try and pull statute out of my head. And then for those youth that are under the age of 14, it'd be the consent statutes that the legal guardian could consent to that being released to an attorney, to a CASA, other folks. We're just kind of hitting these snags of worrying about like providers, and I don't know if there's any providers on here that this applies to, but worrying that the video actually being a copy of it going out into the world is a liability too great for them to manage. And then also feeling like they are violating the right of the youth to be able to consent to whether that is something that is available and shown or not. I know I didn't answer that very smoothly, so I'm sorry, Alicia.
No. It's just like it's my little analytical brain like just is firing off, but I don't want to hold up the conversation, so I can just pop my questions in the chat and I can have other folks to ask whatever they want to ask.
I think to answer
in terms of your one question about
yeah.
attorney or court-appointed advocate getting in trouble for broadcasting the video, I mean, yes, possibly, but that doesn't unbroadcast the video.
I think the only way that it would be protected is if there is a court issued protective order on it, and that isn't going to exist in cases that don't have a dependency court involvement. So I'm not sure where that like the court order for protecting that record from distribution would exist.
Do we have other questions in this area? Because we do have one more piece of this section, and I think it picks up back with you again, Michelle.
Yeah, this section is all about the enmeshment of regulations of medical
Can we
and
put there we go, sorry.
medical and non-medical transportation services. And I will tell you, I've tried to dive in this issue over the past like 3 or 4 months, and it is incredibly complicated. So I just will say there were some regulations passed that blended regulation of medical and non-medical secure transport. And in 2022, some amendments were made to help detangle that just a little bit so that we didn't have children stuck in hospitals at CCAs because they weren't licensed CCAs as an ambulance or as a medical transport. And so kids were not being transported, and it created this whole kind of kerfuffle. Passed legislation that helped resolve some of that, but there's still overlapping regulations that are incredibly complicated and have resulted in a lot of confusion over how these different types of service providers are regulated. Essentially, what this legislation, this proposed LC does is detangles that and says child caring agent, as a secure transport provider, to be required to be licensed as a child caring agency, you are non-medical. So ODHS is going to regulate, as a child caring agency, non-medical secure transport providers. OHA is responsible for regulating all medical transport providers. If there is increased regulation needs to happen on the OHA side, we ask that that be kept separate because they are very different services and different regulatory authorities over them. So that's the big detangling, making it very clear that medical transportation providers do not need to be a child caring agency, including an ambulance. And the second piece that we take on is restrictions on CCA secure transport providers. Today, as I understand it, we contract with one, ODHS contracts with one of these providers. We only have one licensed CCA secure transport provider. I think we are very close, if not already added a second. I think it's really important to say both of these providers are actually not based in Oregon. They are based in other states, and they fly to Oregon in order to provide this service. And so we have not been able to cultivate or create this in our state. So one of the things we are trying to clarify with this statute is about the authorization of when they can use a restraint. So today, if a child is in an unsafe situation, let's say they're in temporary lodging, and that's determined to be an unsafe situation, they need to go to a hospital, they need to go to a medically necessary and appropriate treatment center. We are not we can schedule for the secure transport company to come to Oregon to provide the transportation, but they are not able to do anything, even like a transport position to guide the child to the car. And so this is resulting in, and I guess I should say it's because the child at the time is not actively hurting themselves or others. But there is still imminent risk that they need to be in a certain level of care or treatment. And so there's a clarification in the statute that says if a restraint is necessary for the purpose of successfully transporting a child because of their health or a reason for health or safety, that the secure transport company can initiate, obviously the least restrictive restraint possible in order to ensure the health and the safety of the child in care is successfully transported to the necessary location. Just want to pause there for that one. And then I have a bunch of other mixed bag of amendments that fit into this LC as well.
Questions or comments about this one? This is another one that I think feels very agency, but is actually coming from parents of children who have been unable to get transported from wherever they live to wherever the facility that they need to go to is. A lot of youth who are outside the I-5 corridor, unable to get to treatment settings, which primarily exist on the I-5 corridor. Or parents of children who have disabilities and mental health challenges and are struggling to understand how to navigate all of that, feeling like if secure transport were a better option for them, they would be better able to manage their own child's care instead of doing a voluntary custody agreement like we talked about at SOCAC a couple of months ago. No questions, Michelle.
Okay. I think if we could jump down to 46, I think I've covered the other pieces, Robin. Sorry. Okay,
You're
so
good.
these are a bit of the mixed bag of other improvements to child safety protections that are in the bill. To align with federal law, we're aligning Oregon statute to add a child abuse definition around human trafficking. There is a small technical fix to change electronic reporting from a shall to a may. This is something that the agency is working on creating a portal for electronic reporting. It currently says we shall do this, and we're kind of past that implementation date, and so we need it to be a may until we're ready to put that forward. Background check requirements for children in care. This is also a very technical agency fix. Right now, there would be a requirement in statute for the agency, regardless, we may have known this child for 10 years. When they are 18 years old and living in a foster home, we would have to do an FBI fingerprint background check on them in order for any new children to be placed in their home. Again, ODHS, child welfare, will have access to all of their criminal history, all of their other history that may be considered if a placement of another child in the home is safe and appropriate. We're just asking for the technical FBI background check to not have to be a requirement of our children in care. And then reducing the housing barrier for older youth. This removes the requirement for youth in independent living facilities to have to financially contribute to housing expenses and support costs. The agency will simply be covering that. We already are covering full placement rate for youth and ILP programs and settings through treatment services. So this will not have a significant impact, but makes it our practice align with what, align statute with what our current practice is. And there's no anticipated impacts to tribes specifically. Oh, this is a different one than that.
Well, this ended up at the same place in
that's
there.
okay.
Now. Yeah. Do we have any other questions in terms of the rest? Anything related to transportation? I did see, Alicia, you had a question in here about the affirmative the age of consent. So if the guardian's consents without youth consent, then couldn't the parent guardian? Oh no, we're talking about transportation, not recording.
I know that.
Okay.
I was talking about, okay, there's a two-part question because my brain, it funnels back to the first one, or it funnels back to the recording. But the first question really was about transportation. So if it isn't, if this change in the law allows for restraints to be used, if the guardian consents to, or if the guardian essentially requests the transportation, the youth, even though they have I guess even so their consent is only in the affirmative, so they can't say no, I don't want to go, and then that be used as them not consenting to going to treatment, right?
I so appreciate this clarification, Alicia. So this is actually likely to come up. I would encourage you, if or all of you, there is going to be a presentation on the CERT recommendations, the Critical Incident Review Team recommendations on the recent fatality of a youth in temporary lodging. And this issue was key in that, where we had a youth who was at imminent risk of had significant suicidal ideation, and how the statute was interpreted is that the minor because he was over the age of 14, he had to consent to transportation to go to the hospital. And what we're saying is that, and what I understand is the state is looking at that and saying, that's different when you are a minor and there is imminent risk of severe harm to yourself or others. There is a role for the legal guardian to be able to direct that despite a youth's decline or refusal in these very heightened, extreme circumstances. So that is, I want to highlight that because the agency is going to probably be bringing that up and bringing it into this LC to change those minor consent laws to make it clear when a legal guardian has the ability to overrule a minor.
Okay.
If that
This
makes
has
sense.
nothing to do with that case, but DOJ recently issued an opinion, Alicia, that says that kids can consent them into care if they're themselves into care at 14 or above for behavioral health care if their parents don't consent, but that the parent still has parental rights up to age 18 for a child who is not consenting if the parent says they're at an imminent risk or they need treatment or whatever. So that's what I meant by affirmative, right? The kid can say yes, even if their parents are saying no, but their parents can still say yes, even if the kid is saying no, as long as they're still that legal guardian.
That makes sense. And then, but the current law doesn't allow for the restraint to happen if the youth says no.
The current law doesn't allow for the restraint to happen at all. The transport position, even though it's like in one of those intervention strategies, is still not allowed.
Right. So even if the youth is at imminent risk of themselves, like hurting themselves, or okay.
The threshold today for those is imminent risk of serious bodily injury to themselves or others, and that is a difficult at times to interpret threshold when the child in that moment is completely calm, not harming themselves, not harming others. How do we define imminent in those circumstances? And what we're trying to say here is that if it is based on a safety issue, health or safety issue, that they need to be successfully transported to a specific location, that is enough for them to initiate, like a transport type restraint to escort them to the vehicle.
Michelle, I don't think most people know what a transport type restraint means. Do you have enough information to describe that?
The ones that I have seen in video over the course of my work has essentially been a child having their arms held and walked to a vehicle. And they could be resisting, but the momentum is continuing to go into the vehicle.
Okay. So it could be fairly dramatic. I mean, just sort of what are people imagining, right? And what's the reality? I think it's helpful to understand if there's a difference or if it's not. I see Robin.
Also an interesting dynamic existing today where youth have learned that if they say no, nothing happens, right? And so it's just a tricky situation, especially as child welfare as a legal guardian, to then continuing to know that a child is in an unsafe situation and not in the right level of care or treatment that they urgently need.
Thanks, Michelle. I see Robin's hand up, and quickly, I'm just going to call out a comment from Jesus in our chat. She says, with regard to minors, even if it's to prevent imminent harm, it still requires reporting and approval, and even then could be considered abuse. So that's a comment from Jesus. Robin.
The one thing I was going to add in there was around the issue that Emily raised around imminence and education. We're seeing this play out in the adult system in the lack of clarity around imminence, where in imminence, especially in the conditions where we're looking to place someone on a notice of mental illness or take someone to civil commitment, imminence is defined differently depending on which county council you're dealing with, which DA you're dealing with, who's following which piece of court of case law. So we run the gamut of anywhere from, well, if this person isn't going to die within the next 24 hours, then they're not imminently at risk. And there are many different examples of how that plays out and results in very tragic consequences. So the definition, it's not necessarily a training issue. It is a definitional issue that's causing a lot of confusion and a lot of harm to a lot of people. This section, this wraps up our sections related to the bill. The next slide talks about the SOCAC reporting requirements for this. So this legislation has a lot of mandates that we discussed in there that along the way, exceptions, whether it's to an out-of-state placement or exceptions to the qualified residential treatment providers or any of those other types of exceptions that we talked about, there will now be a process where instead of being prohibited outright, those exceptions will have to be reported to the System of Care Advisory Council, who's then required also to report. And those are things that we do. This is part of what it is that we do. So we're very interested in being able to coalesce, and perhaps what we see in the and I'm just going to make this up here, but perhaps we start seeing a pattern where there's a certain type of out-of-state placement facility that we go, we have a sufficient number of this type of individual that perhaps we need to talk with the provider community about having that as an in-state resource as opposed to not having that as an in-state resource. An easy example is looking at intensive inpatient eating disorders treatment. Oregon has a very small population and it does not have a very large population, and I see this, play out all the time, but we don't have a sufficient number of kids at any given time to have a specialized, highly specialized environment like that housed within Oregon. So those are some of the things that we're hoping that SOCAC can begin to discern and make recommendations to the legislature, make recommendations to the provider community, and really take in the feedback from youth and families, because this is so very important. I think that is the end of our slides and gives us the ability now. There may be one more slide, Anna.
No, there's all the proposed amendment
proposed
slides.
amendments. Okay.
I think there's
All right.
3 of these.
Yeah, let's go through these really quickly. We had some proposed amendments. These came, Emily, did you want to speak to these since these came from you, or do you want me to just read them out?
Oh, I didn't know I sent any amendments in. I shared my concerns. Is that what you mean?
Yeah, those were I'm sorry, we were looking at your concerns in terms of wanting to align the definition with the federal definition of chemical restraint and allowing placements in non-child caring agencies when medically necessary and appropriate.
I mean, I
I'm sorry,
don't.
we took those and turned them into amendments.
Yeah, so I think I can't speak to the amendments, but do you want me to speak to my concerns or should I wait?
Well,
Robin, I'm happy to source these if that's
source those. Okay, thank you.
Yeah,
I
so
got the source wrong. My
the
apologies.
first suggested amendment is actually something that when we initially kind of looked at the LC language that we got back with this last draft, we noticed that the language that we asked for was not in there about placements in non-CCA settings when it is a medically necessary appropriate setting. I'll give you a quick example. 17-year-old who is diabetic, also has a substance use disorder, and is has a very unique first language. And the only placement we could find that would be most medically necessary and appropriate was an adult SUD setting. So being able, and that is not licensed as a CCA. But for linguistic, cultural needs, also to meet medically necessary and appropriate treatment for substance use disorder in combination with diabetic needs. That was the necessary and most appropriate placement for that youth, and moved him out of temporary lodging. But I believe today, depending on how you read statute, it is quite confusing whether that is allowable because it is a non-CCA setting. Second one is, I think we did get from you, Emily Cooper, that was an example of the aligning the chemical restraint definition to the federal definition. Just a lot of confusion in general around chemical restraint and folks not wanting to get it confused with your standard treatment for behavioral health or medical needs or psychiatric condition. I think we have more in the next slide.
Yeah, on the next slide, we have this was something that Allison Starka brought forward and addressed earlier around making the training inclusive of all of the agencies that provide care. And Alicia, this was the recommendation you brought forward about developing the Oversight Council comprised of youth and families. Two things that we think are great additions to this. And these ones, I'm going to give back to you.
Yeah. So the amending section 11, this is what we have learned and received feedback from NAMI, which, do you want to say what the acronym for that is, Robin?
National Alliance on Mental Illness of Oregon.
Thank you. And aligning the video release with minor consent, like existing minor consent statutes. Section 12 is about adding the panel for crisis intervention models. And then there looks like there was an error in drafting that section 39 repeals section 1, and I think it's supposed to repeal section 37.
Yeah, I was going to say, we liked Alicia's suggestion so much we included it twice.
Okay, now we can move into discussion of the entire, I believe that is our last slide. We have options. We can co-sponsor this bill. We can endorse this bill, but not co-sponsor it. We can also not support this bill. But there is no guarantee that the bill will move forward without our co-sponsorship. We have our consensus process outlined and we have time. So what I would recommend we do is to take the next 20 minutes or so, less time if we need it, and let's have a conversation amongst all the members of the SOCAC around how are we feeling about this? What path do we want to do? Anna, I'm going to turn it back over to you.
Is it helpful if I pull down the slide so we can see like more of each other in the space, or is it preferable to have a slide up?
You know, one thing that I think could be kind of helpful I asked you this when you and I talked last week. Can you talk through kind of what, like, I know we saw the options for what the sponsorship things would mean. But can you talk about like what happens if we don't? Like where these things go? Like what happens to this if we decide this is not something we want to do? Or what happens if we decide, yes, we do want to do this?
Sure. So if this is something we decide we don't want to do, most likely the vast majority of what is in this bill goes away, and a few of the small regulatory tweaks that were added in around some of the things at the end that Michelle covered, like not background checking a 19-year-old in order to stay in their own family home, may be able to move forward just as a DHS bill. The governor's office was pretty clear, if the SOCAC is not in support of this concept, that's advice to the governor's office from us around whether they should support this concept or not. Which is why it's unclear as to whether anything would move forward from here if it doesn't move forward with SOCAC's if it doesn't move forward in partnership with the SOCAC. So there's a small chance that we could say like, oh, we're uncomfortable, but we want DHS to go ahead and do it, and that we could then endorse it, I would say that's like a 5% chance of likelihood based on what I think the role I think the governor's office really wants us to play in the system overall, right? Our job is to make a recommendation, and so that's what they're asking us to do. If we choose to carry this in partnership, so it would be a bill that was introduced by the SOCAC and DHS, if that's sort of what it would say on the top of the bill. If we chose to go that route, then we would have as many conversations as we want to, either in the full council or in the legislative committee or other spaces, to continue to workshop this bill and try to get it to where it has the intended impact that we're looking for, which is really opening that door wider, making sure we see no decreases in quality of care, ongoing monitoring and reporting to and from the SOCAC around the impact of these policy tweaks. Are we actually seeing kids get to care? Are we seeing a decrease in temp lodging? That's sort of the intent of this concept. If we're holding tight to that intent and adjusting how we go about that, those are conversations that we can have really until like February, when we would be hitting an amendment deadline. Emily.
Well, my recommendation for the group, and I understand the intention from this, is that we don't co-sponsor and we don't endorse for really three big reasons. One, I think we're the wrong entity. This is a provider, you heard about who was consulted, who provided the guidance, and providers don't need any more of a megaphone. They've got it. They do great work. There's no shade, but that's their role. They understand that. I think we raise real questions with the legislature if, as the System of Care Advisory Council, with all the commitments we've made to lifting up youth and family voice, that the entire process up until today, or the past few weeks, hasn't included youth and family voice. It's been providers. And that's not really our role. I also think reporting to us when we are not providers around some of these exceptions raises similar concerns. Like, this is not, we're here to provide advice, not be a regulatory or a clinical body providing direct care to young people, or even questioning what kind of exceptions or clinical care. I mean, maybe I'm just very well aware that I'm not a clinician and there are people who are, and I respect their independent judgment there. I'm an advocate. I'm not in the position to say with the reporting whether or not that's even appropriate. I think it's also the wrong process. This seems fast. It seems like there's the potential for a lot of mistakes. I can understand why maybe I was attributed one of the amendments, because I think my biggest concern right now is some of the changes to restraint and seclusion don't comply with federal law or existing state law. That includes chemical restraint, that includes the definition of imminence, and that restraint doesn't include briefly touching someone to like help them get in a car or do a therapeutic side hug. I mean, it's not there. And I also think it's the wrong change. Like, I understand providers are concerned. I heard that a lot today. For me, there are other more important and critical changes that the SOCAC, we can and should be asking for. Like, if anything, increased accountability, increased information. Where's the providing of more resources and support so providers want to engage? I think this would be a huge mistake if we move forward with this. And I honestly worry about the SOCAC generally, that the way this is going to get spun is that we got co-opted into a provider bill, and that's not our role. And so I would really urge us to think very, very carefully about this. And if we are to do something this big, to have a much better, more thoughtful process that much more involves youth and families at the decision-making table. And I'll stop.
Thanks, Emily. Robin?
I'm gonna start out and disagree. This process started 2 years ago when we were working with the safety work group report. And when the safety work group came together, there was significant youth and family voice. There's been significant youth and family voice, informing, giving testimony, people whose lives have been impacted by the things that are addressed in this bill. Everything that we see in here can be tied back to youth and family voice. But youth and family voice often has our complex processes for making laws are complex and have to be done by the policy wonks. Knowing that when I first got involved in building legislation, I didn't have any experience in that. What I would put forward and take to Leg Council, I couldn't even tell you how it got to where it was. I relied on lobbyists, experts, and other people to help me. And I'm better at it now than I was a decade ago. But people took my family voice at that point and helped me turn that into law. And I do see that as an important part of our role. We went out and sourced information and took people's concerns and took them to the agencies to say, here's the concerns youth and family are coming. How do we fix that? How do we do that? Knowing that youth and family couldn't be the ones who actually did that, because, candidly, I've got the privilege to be able to sit in front of that group and say, I'm going to lift up youth and family voice. Here's the stories, here's the narratives, here's what folks are wanting, here's the change. And it really was that power of the partnership. I don't think it's fair to the process to say youth and family voice hasn't been involved. The last several weeks, yes, have been a shuffle to get this through. It's a 91-page bill. I've got drafting stuff that's not out yet from Ledge Council. I mean, we know how slow the process can go. And my apologies for making the misattribution. That was completely my fault. I misunderstood. We have, as Anna said, weeks that we can go forward and talk about things in Ledge Committee, bring it back in January. But I do think this is our role. I do think, if not us, then who? Because we're the ones who went out and gathered the information from people and said, tell us what you need, tell us what the recommendations are, tell us what it is we can do to fix the system. And then if we don't take action on that, who are we? Just a group that meets? And I don't want to be that anymore. Thank you.
Adam Rodakowski.
Hey, yeah, thank you. I just also want to agree that with Robin that this has been a couple of year process, and we have taken in youth and family voice at every turn. Now, in the last couple of weeks, right, with the drafting of the bill, obviously that was done by Legislative Council. But this isn't a provider bill. Does it impact providers? Yes. But at every turn, this has been about how we better serve children and families. And we are, our council is the central impartial forum for statewide policy development, funding, strategy recommendations, and planning for the governor on the children's system of care. And we're supposed to improve the effectiveness and efficacy of child-serving state agencies and the continuum of care that provides services to youth age 0 to 25. That's the charge. And right now, the system is not working for kids in Oregon. We're last in access to care. We're hearing stories today about children losing their lives or having their lives put at risk because of law that doesn't function to serve children. And so I disagree that it's a provider bill. I think that if we don't co-sponsor this, I can tell you that nothing is going to change in the kids system for Oregon. Like this is the major piece of children's legislation that could happen in a system that doesn't function for kids. And so if we do nothing, then nothing happens. And kids continue to suffer the way they are today. So from my position, I represent a child caring agency, so I'll be open about that. I am a provider, but I'm in this business to help kids. And so while I'm representing provider voice here and a whole bunch of really good providers that operate in Oregon and want to do better for kids and families and don't feel like they can, and we've talked with those kids and families and tried to make some changes that would allow them better access to care. So I would urge people to support a co-sponsorship.
Dan, Toma.
I'm awestruck by the amount of work and thoughtfulness and collaboration that went into putting this very comprehensive bill together. And there were a lot of voices when some of the previous legislative changes happened, predicting that exactly what would happen is what has happened, that it would decrease our system's capacity to provide care to kids who need care. And that's what has happened as a result of some of unintended consequences of well-meaning legislation. We, as a System of Care Advisory Council, have a responsibility to look at the system as a system and to look at the drivers of the system functioning the way that it functions. I think these unintended consequences of some of this previous legislation are driving the way the system is currently functioning, not in service of kids and families. And I think this is an incredible effort to address those issues, and I fully support SOCAC co-sponsoring this bill.
Jill.
Thank you. I just want to echo what my colleagues Adam and Dan said. And I think I watched this all play out. I was one of those folks that said like, well, I think I can predict what's going to happen here. And the dramatic loss of capacity in our system, I think is largely due to some of these rule changes. And on the CCO side, I get involved only when in my role, I get involved when something is really escalated and really broken and really not working, and like the governor is involved. And in almost all of those situations in the last 6 months, I can point directly back to this as the issue that got us here. Like you can just draw the line of why that youth is in temp lodging or in the ER and not in the appropriate level of care. So I think the risk of not doing this is much, much greater than any potential risk of moving this legislation forward. And I think a lot of that would be mitigated in protections that are embedded in it. And I would endorse it that we co-sponsor it.
April.
Thanks for taking my comment. I would agree that both the process, the intent, and the collaboration that went into the drafting of this omnibus bill, although providers will be absolutely impacted, that was not at all the intent. The intent was really to listen to community, to workforce, to providers, to people with lived experience about barriers they were experiencing and accessing what they need. And I just want to remind people that not all community voice and community engagement is happening in this meeting. I am getting calls and emails all day, every day, families who are struggling to figure out how to help their children, who have no choices but to take a child abuse founded allegation because they think that it's going to help their kid get what they need. Safe parents. I am hearing from community every day, our Parent Advisory Council, our Child Welfare Advisory Council, our ICWA Advisory Council. People with lived experience are talking to us within state agencies all day, every day. We are doing deep community engagement and listening and trying to work with any providers, any partners, any advisory councils that are willing to come together and say, how do we collaborate to make this system more accessible, useful, equitable for all kids and families in our state, and particularly those who are in foster care? Because quite frankly, the fact that they are in foster care right now, it means that they're less likely to get what they need, not more likely to get what they need. And the last thing that I'll just call out is that we can have all of the investments in the world, and I'm really grateful getting the governor's recommended budget come out. I broke down into tears at the partnership and the willingness to invest in the safety nets for our children that are going to help prevent unnecessary foster care and help get kids back where they need to be. I do believe it's a good step in the right direction, but if we don't have providers and workforce who are willing to do the work, the investments mean nothing. And so I think, social isolation is one of the biggest contributors to to people being involved in systems that where we have bad outcomes. And any of us in this space who care about young people, thinking that we can solve it on our own, it doesn't work. It doesn't happen. It won't happen. Child welfare cannot fix this. And when I came to you all, maybe it was like a year ago and said, I need your help, system of care, I really, really want to just say that I appreciate all of the hard work and the thought that went into trying to put something together that might address some of the barriers that I see and that I hear about happening in the everyday. And I appreciate it, no matter how far this goes or if it doesn't go. I really, really appreciate it. Feels like there are people that are stepping forward to try and listen to families, listen to communities, and yes, listen to providers, because we can't do this without all of us. So I really appreciate all the engagement and hard work that went into this. And though I won't tell you how to vote, I appreciate that there's effort. Thanks.
Ebony.
I'll be super quick. So definitely want to ditto what Robin said, what Adam said, what Dan said, what Jill said, and what April said. Just because equally when Jill's pulled into spaces, I am on this side. I too, day in and day out, am getting feedback, input, pleads, all kinds of things. The one thing that I just want to say is that from my perspective, also, reflecting on when I was in the provider arena, when I was on the county side, and now being at the state, we have been able to see that this SOCAC is a result of the inability of system experts being able to come together to create and influence policy to better serve those that are relying on the system. And so there was an explicit reason why SOCAC was established. There was an explicit reason why folks were selected to be here. And, we all can reflect back on failed and ineffective committees and task force, and we cannot have that anymore. And I believe it was Adam that said it first, is that this is centered on the children, family, and youth that are relying on us because we have no choice but to start to leverage our expertise, our partnerships, our collaboration for the betterment of those that are relying on us. And the last thing I will just say too is that we always will have an opportunity to further refine and enhance. So thank you.
Jackie?
Sorry, took a minute. I had to switch my phone, so I apologize. My camera isn't on. I just want to voice my support in this. Lots of folks have had incredible things to say that I deeply feel about our position on this council and what we're intended to do here. But it is, I believe, our responsibility to support this for children and families, just as everybody else has said. I just think about the access and families, specifically in rural and frontier communities, who really struggle to rely on having to come to Metro for services and supports. And I think one of the pieces of this that really sticks out is how we use some of those out of state placements because Oregon doesn't have the resources. And it's not that we should stop fighting to increase those resources. It's that we need to be flexible in finding other ways to support families right now who need the help right now. And if there is exceptions that we can support for families to get that access they need for their family unit, then I believe that we have a responsibility to move that forward for them. So I just wanted to put that out there that I support this and want to continue finding better solutions
for all those who need us.
Allison Stark, Alicia, Dana, then I'm going to read a comment for Jesus, and then we're going to, from Jesus, and then we're going to have to vote because we also still need to create space in case anyone showed up for public comment. So, sorry. This has been a really great conversation, and we have a time limit. So, Allison?
I will be very quick. So I probably am one of the people that had to be the most convinced on doing this. I'm just going to be honest. We haven't had the same challenges that some of our providers, that colleagues have had. With that being said, from my perspective, I trust that everybody in this room, virtual room, is all here for the right reasons. And if my colleagues are, and if there is this much effort and work put into this, there is a problem. And that problem, we are a System of Care Advisory Council. We are responsible for making recommendations like this. I think, Emily, I adore you, but the provider, versus everybody else kind of perspective is tough as a provider. I mean, I was also the DD director in Illinois, and it's really easy to demonize certain groups. But I think that everybody at this virtual table is really wanting to make a better system for kids. And so I actually am going to say that this is just a legislative concept and just a bill concept. There's plenty of time for us to, work through some of the most concerning areas. But to say that we're not going to come to this from a place of collaboration when my colleagues and when even I have some challenges on the transportation and on which, kind of systems are restrained, to say we're not going to enter into that dialogue seems like a really big missed opportunity and really isn't kind of coming for that spirit of collaboration. And so I just want to say that I support moving this forward with thoughtful discussion as we move forward about how we make sure there aren't unintended consequences that could potentially cause damage. Thank you.
Alicia?
Well, here I thought I was going to be the only outlier. But Emily, okay, so I'm gonna preface everything I'm gonna say with this, that I am extremely, extremely thankful and appreciative for my voice as a family member and family rep being heard and integrated into even like the amendment already without me having to, bring it up today again before, it's being integrated. So I really appreciate the amendment being put into today's presentation regarding a task force for family members and youth to provide input to these frameworks and models to be used for crisis intervention. Having said that, I wish this bill would have been kind of broken up into several, or this concept would have been broken up into several different separate concepts, understanding that that SOCAC only has 2 that we're allowed to have. But it's just a comment because there are so many different pieces in this thing that can be very convoluted. And that's one of the reasons why I actually do agree with Emily in terms of that it feels like a heavy provider bill. Not saying that it's a bad thing that it's a provider bill or that I feel that it's a provider bill, but that it just feels very provider heavy. Again, not saying that's a bad thing. I will say that my experience for a lot of the biggest pieces that I have an issue with in this bill, my experience and the experience that I hear from other family members is not the same, or not, not necessarily completely the same as, some of y'all are hearing and getting feedback on. But overall, what I wanted to say is that I do think it's a much deeper problem that we have than just updating the restraints and seclusion definitions. This is like the problems that we're seeing in our system is way deeper than being able to restrain or not restrain, being able to, use a facility outside of Oregon or not. So I just wanted to say that it is a lot deeper than that, and I hope that we can have deeper conversations as we move forward.
Dana.
Thank you for that. I'll try to be quick. I sit here on the SOCAC as the interim DD director and have about 10 months of experience maybe now in that role. So definitely not the depth that many of the people in this virtual room have. What I can tell you from that experience is the cases that I have been pulled into to assist in finding placement for children who desperately need services, and having to sort of, not to be pejorative, but to cobble together a setting and services for individuals so that their needs can be met. And then in my previous role as the former state Medicaid director, understanding that we have agreements and requirements of contiguous and out-of-state providers in our Medicaid program that allow us to serve children who are not involved in the child welfare system out of state. It feels like we've created a disparity, and I understand why. I understand, all of the issues that have come and these bills that have resulted from those. But I just would love to see a system where children have adequate access to the services that they need, and we're not putting unnecessary requirements or roadblocks in getting children served. And I see that in the system that we've created through Medicaid, through child welfare. And the fact that we have to create an alternate system in order to get children's needs met that's where I think that the system is broken. And this legislative concept is not going to fix everything, all the problems within the system, but it's a place to start. It's a place to start having these really hard conversations and figuring out how we can get this done for kids. So I support it. So I just wanted to lend my voice to that, and thank you for the opportunity.
So just wanted to quickly read out what Jesus put in the chat so that her voice can be heard too. She says, I think saying this covers everyone's perspective and voice and experience would be wrong, but not following through would be disregarding the multitude of voices that have gone into this. While as stated a couple times already, this does affect providers. It is not for them. We have to do what we can to save who we can. Is this perfect? No. Is it the end all be all? Hell no, in all caps. But it's a way forward, a way we've worked on for a while, and we have to do something. And then Annette, I don't know if you want me to read your comment out as well. I think want to make sure that the family voice components are included. So Annette says, I support this 100%. I see parents every day who are struggling to keep their kids safe. See 12 kids die due to lack of service and placement is too much to bear. So I'm going to put our voting slide back up. Does someone, we're not really super formal in here, but would someone like to propose what we vote on first? If we vote to co-sponsor with ODHS or something else, where should we go?
I would propose we co-sponsor with ODHS. That seemed to be the prevailing commentary in the chat.
Thanks, Robin. Are there any racial equity impacts we need to consider or discuss before we move to our voting process? Does anyone want to name a population that would benefit from or be burdened by our deciding to co-sponsor this with ODHS? Since no unintended consequences have been mitigated, I don't see that we should be naming any strategies to have been identified. I don't see if we can name strategies to mitigate them. However, I strongly encourage, if this vote if we vote yes as a community, that we continue to dig into these exact questions and review them and make sure that our work is addressing all of these concerns as we move forward. And would anyone like to call for completion of the racial equity worksheet before moving forward? Okay. So first step is finding out if there's anyone in the room who wishes to block the vote. If you do, please raise your hand or speak up. Okay, is there anyone in the room who wishes to stand aside and remove themselves from the vote? Emily Cooper and Alicia are standing aside. Is that accurate, what those hands are for?
Yes.
Okay. Is there anyone else who wishes to stand aside? Is there anyone who wishes to discuss further reservations? Okay, and now if you are a voting member of the council, please raise your hand if you agree to the motion for SOCAC to co-sponsor with ODHS. And I will read your vote out. If you aren't able to raise your Zoom hand for any reason, please unmute
Anna,
and speak your vote.
question. Is there an agree with reservations and an agree, or is there just agree?
There's agree with reservations.
Okay, I am down for agree with reservations.
Okay, please note Corinna in the notes. Allison is agree with reservations.
Thank you.
Thank you, Allison. I'm sorry I skipped that. Okay, and then these are the folks who agree. Robin Henderson, Adam Peterson, Adam Rodakowski, Jill Archer, Andrew, Dan, Jackie. I'm sorry, I have to say your whole name. Andrew Grover, Dan Toma, Jackie Serrano, Annette Magicotomy, Kyle Johnson, Ebony Clark, April Flint Gerner. Dana Hiddle, are you voting or not?
I am voting yes. Sorry, I put my hand up and then I took it down. Yes.
Okay.
Raise it again for the record.
And Jesus is voting yes as well. So that's 15 yeses, which means the council will be co-sponsoring the bill in partnership with ODHS. What that also means is that tomorrow at 8:30 in the morning, we will be having our first legislative committee meeting about this bill and taking suggestions, recommendations for amendments and improvements and deep conversation around how we have the conversation that we know we need to have. If you are not on that invitation list, the public meeting is on our website. We are also happy to email you the link to that. It does now meet in Zoom instead of Teams. I apologize. I am skipping over if you are a SOCAC member who wishes to make an announcement or an update in case there's anyone in the room who wishes to make a public comment. If there's, we had someone who had reached out and said they wanted to come make a public comment, and that's why I'm kind of anxiously trying to make sure we have time for them. I don't know if they're here or not. If you have a public comment you wish for someone else to make for you, oh, thank you, Joylene. Just put the link for the LegCom meeting in the chat. If you have a public comment you wish for someone to make for you, you may chat it to Joylene Carter, Alicia Overstreet, or Annette Magicotomy, and they're happy to read it out for you if that feels more comfortable. Or safer, or whatever feels better in whatever way. Wow. Okay. Well, we are currently tentatively scheduled to meet on January 7th, same virtual location, same virtual place. We also need to consider as a community how we're going to change our meeting time so that our youth members can be more present and active and engaged in this work. We have a proposal from a youth we'll be talking about soon. Thank you all for your time, for your participation, and for your genuine engagement in today's important conversation. Annette, is there anything else you'd want to say before the end of the meeting?
No, that's it. Thank you for coming, everyone.